our Social Services Subcommittee meeting. We will go at ease while we wait for a quorum. Thank you.
Thank you. Madam Clerk, please open the roll for attendance. Already did. Okay, it looks like we have a quorum. Good afternoon, everyone. We do have a busy docket, so I definitely apologize in advance if testimony goes from 1 minute or I'll just group you all in 5 minutes. I just want to apologize in advance depending on how many people are testifying for or against. Right now, I see one delegate right over there, so we can start with Patrick Hope. We have Hope. Patrick, 560.
Thank you, Mr. Chairman, and I do have a substitute.
So moved.
There's been a motion and a second on the substitute. Would you like to speak to it, or
I will speak to it. I'll speak to it, Mr. Chairman. House Bill 560, this has been something I've been on a journey for about 3 years now, and the bill has never made it out of appropriations. I don't think that it will have a fiscal impact, but if you do vote favorably, it needs to go upstairs because I think it will be pulled off. This clarifies how decisions for essential benefits, and we're thinking about people that are on TANF and Medicaid and SNAP, can be appealed. If you're denied, say they're not eligible, you should have the right to appeal. Right now, the code is so restrictive, and I think it's very confusing. And low-income people seemingly have no right to appeal these types of decisions. By seeking a consistent standard, which is what House Bill 560 seeks to do, these disputes will be faster and it will streamline the process, and you'll make sure that people that are really eligible to be on these, to receive these essential benefits, won't have their benefits cut off in the interim. So we'll streamline that process. The appeals will be based on the agency's word. It respects the expertise of the agency, while at the same time still providing a robust check against arbitrary and capricious denials of benefits. In summary, what House Bill 560 seeks to do is create a more uniform process across different types of essential benefits aid, ensuring that Virginians' right to appeal doesn't depend on that specific program they're accessing, which just creates a standard across the board. We all know with the so-called one big beautiful bill, there will be a lot of people, a lot of Virginians whose SNAP benefits, Medicaid, they'll be cut off. They deserve to have the right to appeal these decisions. This is really about due process. This is about fairness and ability to access justice. And so that's what the bill seeks to do, Mr. Chairman.
Thank you, Delegate Hope. There was a motion and second on the substitute. All in favor, say aye. Aye. All opposed, say no. All right, it's House Bill 560 is all properly in front of us. So now we'll take testimony. How many people are for House Bill 560? All righty, come on up, 1 minute each. And if you can state your name and the organization you are representing.
Thank you. Good morning, Chair, members of the committee. Good afternoon.
Good afternoon.
Losing this week already. Emily Hardy with the Virginia Poverty Law Center, and we support this bill. We work with legal aid attorneys who help low-income people try to access benefits and try to appeal those decisions. They look at this code and they don't understand what it means, and they're not able to give accurate and good advice to their clients. So we ask that you support this to help us clean up this section of code that's been written this way since the 1980s. So this really is just trying to make sure that the code aligns with what we expect appeals and fair hearings to allow. Thank you.
Thank you.
Thank you very much. Good afternoon. My name is Casey Trombley Shapiro Jonas. I'm the legal director of the Health Justice and Public Benefits Program at the Legal Aid Justice Center. Last fall, our office represented a Medicaid beneficiary who needed a medication to manage a rare condition that has completely transformed his life. The medication would hopefully help him get back to school and finish his computer science degree. We worked with his family after they had appeared for themselves in the state administrative hearing. That hearing lasted 27 minutes, with the insurance company speaking for about 12 minutes about why it had denied the coverage for the medication. The family expected to present their own arguments, but instead they were not permitted to present their case. Rather, the hearing officer asked just one question, and after the family answered that single question, the hearing officer terminated the hearing. The family spoke for a total of 19 seconds. That was not a fair hearing. It was a due process violation that, candidly, our office was not sure we would be able to challenge in court. And that's why we support this bill, so that would clarify appeal rights, and we ask that you also support this bill.
Thank you. And anybody against in the audience? All righty. Turning to the committee for questions, because I didn't turn earlier. Delegate Walker.
Thank you, Mr. Chairman. Delegate Hope, I know it's kind of hard to look into the future here, but how many cases, if you have that information, that we were experiencing this testimony that this last speaker had? I mean, is it a major issue right now? I mean, with appealing or getting a second hearing?
Mr. Chairman, I honestly don't know if there's anyone here that hears those cases that could maybe speak to that. I don't have an answer. I mean, I think that whatever there will be a lot more coming up because, as we know, there's going to be tens of thousands, hundreds of thousands, perhaps, of Virginians that are going to be kicked off the Medicaid rolls. Maybe they're eligible to be on. Maybe they're meeting the requirements, but the people that can represent them, they don't understand the language to clarify that this seeks to clarify so that they have the opportunity to have their ability to have their day in court to appeal. Maybe it won't be upheld, but at the very least, they should have the opportunity to appeal. I don't know if anyone can answer your question directly about how many cases they hear a year. I don't know the answer to that question. It'd be more if we clarified this language.
Okay, so Doug, what I think I'm understanding here that you're trying to get ahead of a potential storm in the future for cases that may be coming up for appeal then. So in other words, this will help for those that may be losing their benefits appealing then. Is that what this, as I understand, that's what this is attempting to do?
Mr. Chairman, I'd respond to that. I've been working on this for a few years, so I certainly didn't know that this tsunami is coming our way. I wish it would pass, but this brings a sense of urgency to making sure that this bill does become law at this time.
Thank you, Mr. Chairman. Thank you.
Thank you, Delegate Hope and Delegate Walker. Any other questions from the committee? The committee.
Move to refer and report to appropriations. As substituted. Thank you.
The motion is to report and refer to appropriations as substituted. Is there a second?
Second.
There's been a motion and a second to report and refer as substituted to appropriations. Madam Clerk, please open the roll.
Say refer and report.
All right. Madam Clerk, please close the roll. Your bill report 6-0 to 12th floor.
Thank you, Mr. Chairman.
Thank you. Next, I see Delegate Anthony. Come on down. The price is right.
That's what you're hearing, appropriation. Thank you, Mr. Chair. I was going into the theme song.
You have House Bill 1452.
Yes, I'd like to move the committee substitute.
Second.
There's been a motion and a second on the committee substitute. Would you like to speak to it or counsel?
It's pretty extensive, if council can help me out.
Sure. Mr. Chair, the substitute, so this is to just kind of give a brief overview of what the bill is doing, is we're looking to create a expedited process for service authorization under Medicaid. So the substitute is, we're taking some of the Medicaid enabling language out of subsection A, where normally we're saying the department needs to seek permission from CMS. We're taking that language out, and we are adding instead language that says that it is using the standard review time frame whenever it could seriously jeopardize the enrollee's life, physical, or mental health, or their ability to attain, maintain, or regain maximum functioning consistent with applicable federal law. We're also removing several of the portions of subsection A that are like laying out what the expedited process would have been. Under subsection B, for eligibility, we are, sorry, it is very extensive. So we're saying that documentation, so previously under the original underlying bill, documentation was done through a certificate of medical urgency. At this point now, it is just, we're saying that documentation can be from a physician or from someone else who's authorized to prescribe services or items that are eligible for Medicaid under this expedited process. Let's see. I think that should capture most of it. There are several additional technical changes throughout. Yeah, Did I miss anything substantive?
Thank you, Council. Thank you, Mr. Chair. So yes, here we have the House Bill 1452 as substituted. Again, as Council has said, is the expedited review of process for Medicaid service authorization request. This bill was brought to us by SEIU, and we have had extensive conversation with DMAS, especially with the latest bulletin on interoperability and prior authorization, the final rule implementation update that was this past December, and making sure that we align with what federal regulations are doing now, so that we can align with what DMAS is doing, but also highlighting what is happening with care workers on the ground. And so the 1452, as substituted, addresses a very specific and practical problem in Medicaid administration. When care is medically urgent, the review process must move with urgency before harm occurs. This bill does not expand Medicaid benefits. It does not change eligibility. It does not alter medical necessity standards. It's just a process and timing bill grounded in existing Medicaid law. And so we wanted to direct DMAS to implement an expedited review process for Medicaid service authorization only when delaying review could seriously jeopardize the enrollee's life, physical or mental health, or the ability to attain, maintain, or regain maximum functioning consistent with applicable federal law. And so this substitute kind of narrows, it clarifies that DMAS shall implement the expedited review process, which they do already. But while preserving the department's flexibility, we wanted to secure the necessary federal approvals and remain fully compliant with the CMS requirements. Second, it does confirm that the required reporting to the General Assembly is aggregate and system level only, focused on performance and timelines, not individual cases, and protected health information or provider-specific data. And it removes the ambiguity by making clear that this bill addresses the expedited decision-making before harm occurs, not post-denial appeals, grievances, or litigation pathways. And so we've done some extensive conversation with DMAS and with the stakeholder, and what is actually happening on the ground. It does not guarantee approval. It does not create any new entitlement. It does not alter medical necessity criteria. Does not require acceptance of incomplete documentation. Does not mandate new testing. It's about how quick the decisions are made and not what is covered. And so we wanted to make sure that we have federal alignment. And so, this is basically the heart and the matter of this piece of legislation. When a service is ultimately covered, delays in authorization can cause preventable harm, longer hospital stays, and interrupted treatment. And so in closing, it does not expand Medicaid. It just ensures that when care is urgent, the review process moves with the urgency of the patient's condition, so that not only the patient is covered, but also the worker. So I thank you, Mr. Chair and members of the committee, that you will support this bill.
Thank you, Delegate Anthony. There was a motion and a second on the substitute. All in favor, say aye. Aye. All opposed? All right, and then you explained the bill as substituted. Now we'll turn to the room. Anyone for the bill? Anyone against the bill? Oh, for? Nope, you're fine. Sorry, I just move a little quick. I apologize. I'll slow down a tad.
That's okay. Tanya Milling with the ARC of Virginia. Thank you so much to the patient for bringing this forward and for all the work to get it in the position it needs to be to protect people. We very much support this bill. Thank you.
Thank you.
Good afternoon, members of the committee. Julia Newton with SEIU Virginia 512. We support this bill wholeheartedly. We've had a couple of members to pass away waiting on this medical equipment, so it's very much needed that this bill pass. And I thank Delegate Anthony for taking the just the hard part to come before you and present this bill, because I know it's not easy, but we appreciate her. And I know what's happening in the community, with mothers like me that don't get the equipment that they need. Thank you.
Thank you. Anyone against? All righty, we're turning online. I do believe we have Miss Mary. If you can, is she online? Clerk, do y'all see her? I don't see her. Okay. Well, Miss Mary, she was speaking for the bill with SEIU 512, so I just wanted to acknowledge that. Returning back to the committee for any questions. Delegate Cornett.
Thank you, Mr. Chairman. Question for the patron.
Go ahead.
Delegate Anthony, I was just wondering, I think this is good and moving in the right direction. I was just wondering, do you know what kind of time frame we would be looking at on this appeals process, on how quickly this would get done?
So if you're talking about the timelines in which DMAS will be able to adhere to federal guidelines, I believe DMAS is in the room. If I could have them come up.
If, Mr. Chairman, if you don't mind, on the appeal,
Right.
how quickly that this will take place inside DMAS for them to get the treatment?
So I am unsure, Mr. Chair. I will answer the delegate. I believe must be completed within 72 hours. As for prescription drugs, I believe it's issued within 24 hours for expedited review. I believe that there has been significant delays when workers have been treating patients on the ground, and because of those delays, they've experienced worker, safety issues because of the impact of the patients that they serve.
Absolutely. Thank you, Mr. Chairman.
Thank you. Delegate Cole of Fredericksburg. All right, hold on one second. Delegate Shin.
Thank you, Mr. Chair. Could I ask for clarification that this would have to be, in order for DMAS to establish this process, they would first have to go and seek approval from CMS?
Counsel.
Mr. Chair, Delegate Shin. So as I understand it, the federal rules recently changed, and I might want to call on my friends at DMAS to explain this. Normally, when we make a change to Medicaid, we need to seek approval from CMS at the federal level. But as I understand it, the federal rules have changed recently and require a different expedited review process for service authorization. So Will or Angie might be able to explain a little
been phoned.
Mr. Chair, Will Frank with DMAS. It's my understanding we already do this, and we've already this is already a federal rule. We've already implemented this. This would just be codifying the existing practice.
Understood. Delegate
Mr. Chair, but is this a Section 1 bill, or would it be going into code?
This isn't going into code. I would, Mr. Chair, ask answer the delegate.
That this is going into
It is going to code. If Mr. Chair, if I could speak to the bill. So I think we do have the federal guidelines. There was some updates with that, the implementation update this past December. However, those guidelines does not prevent any state from building on the floor that the federal guidelines or regulations already have. The states can build on that floor that are issued. And so we have just made sure that we align everything with the federal guidelines by making sure that this bill aligns, hence the extensive amendments that we made to this substitute, as well as some accountability measures that will be fed back to the General Assembly.
Thank you, Delegate Anthony. Seeing no other questions, going to Delegate Cole of Fredericksburg.
I move to report the substitute.
Here, a report. Is there a second?
Or move to report with substitute. Sorry.
No, that's her. There's been a motion. Is there a second?
Second.
There's been a motion and second to report as substituted. Madam Clerk, please open the roll. All righty. Madam Clerk, please close the roll. Your bill reports as substituted, 6-1.
Thank you.
Next, we will have Delegate McClure, and then after that is Delegate Gardner. We're trying to fluctuate the schedule so people can get back to their other committees so we have quorum.
Yes,
so those are one of those days. Delegate McClure.
I appreciate that, Mr. Chair. Mr. Chair, I have two bills, HB 838. Can I take that one up first? And then I have HB 1405.
838, go ahead.
Yes. All right, Mr. Chair, HB 838 would provide the Department of Medical Assistance Services, otherwise known as DMAS, the proper authority to update the state plan to include language from my bill that passed last year to include payments for doula services. DMAS has been unable to update the state plan to include the doula benefit that my bill provided, as the previous governor removed it in the budget. This technical change will ensure that those covered by Medicaid will access or have access to the additional postpartum doula visits that we approved last year. So this is just a technical cleanup bill. Mr. Chair, members of the subcommittee, it's my hope that you will recommend reporting HB 838.
Thank you, Delegate McClure. Turning to the committee for any questions. Seeing none, we will turn to the audience. Anyone for the bill? Anyone against? Turning online, I do believe we have one person, Kendra, with Birth and Color.
Madam Chair, members of the committee, I'm the Executive Director of Birth and Color, and I am in full support of this bill. Thank you.
Thank you. We do not have anyone else online against. So, Delegate McClure, you have the last word on this.
Yes, thank you, Mr. Chair. I just hope that the subcommittee will act favorably upon this piece of legislation. I worked closely with DMAS to put this forward.
Thank you. And just to remind the committee, if it is to report favorably, it does have to go to appropriations.
Move to report and refer to appropriations. Second.
There's been a motion and a second to report and refer to appropriations. Madam Clerk, please open the roll. All righty, Madam Clerk, please close the roll. Your bill reports out 7-0. Your next bill.
Thank you, Mr. Chair. Mr. Chair, I have an amendment in the nature of a substitute on HB 1405.
The substitute. Second.
There's been a motion and a second to move the amendment. Would you like to explain it, or counsel?
Oh, I can explain it, Mr. Chair.
Go ahead.
Mr. Chair, the substitute comes out of conversations that we have had with the Department of Social Services to set a path to create a framework for a state burial assistance program. Mr. Chair, members of the subcommittee, HB 1405 as amended would establish that burial assistance program to be administered by DSS, and the bill would provide DSS the authority to begin issuing regulations allowing local departments of social services to pay reasonable funeral expenses for a deceased person who either received public assistance or was a Virginia resident receiving supplemental security income, provided that sufficient funding is available. The program being established in my bill would not be directive, just permissive, and it would be similar to a previous policy that did exist. It was once referred to as the General Relief Burial Program, which at the time provided individuals with assistance up to $700 for burial-related expenses. Mr. Chair, this bill was born out of a constituent story where their family had to deal with an unexpected death and was not prepared to take on those extremely high costs of burying their loved ones. So this would really help a lot of families across the Commonwealth. Mr. Chair, members of the subcommittee, it's my hope that you would recommend reporting HB 1405 as amended.
Thank you, Delegate McClure. Turning to the committee for any questions. Delegate Walker.
Thank you, Mr. Chairman. So a question for the delegate here. How many burial assistances are we experiencing currently, say maybe this last year, if you have that information available?
Yes, Mr. Chair, Delegate Walker, I really appreciate that question, and that is something that DSS is going to evaluate once this bill is passed, because currently, as we have it, Mr. Chair, all across the Commonwealth, we have a few localities who do this. I know that Alexandria does this, and we are trying to see who else does this so that we can get some data as to what that would look like. And so this bill would even provide DSS the authority to provide that framework or establish that framework and move forward with that type of research that is needed for this program. So that was my first question, Mr. Chair, Delegate Walker.
Thank you. Any other questions from the committee? Seeing none, turning to the audience. Anyone like to speak for the bill? Anyone would like to speak against the bill? All right, turning online, I do not see anybody to testify. So Delegate McClure, you have the last word before I turn it back to the
Thank
committee.
you, Mr. Chair. I really appreciate it. And again, worked very closely with DSS on this piece of legislation. And I don't want to speak for them, but they did express some excitement in moving forward with establishing this framework and having the authority to even work on this in the year ahead. So really excited about this piece that will help families all across the Commonwealth.
Thank you. Originally, thanks to Delegate Cohen, there was a motion and a second for the substitute. All in favor say aye. Aye. All opposed? Thank you. Now it's properly before us. So we did not get a letter to report this to appropriations. So if there is a favorable motion, it's just to report.
Move with substitute.
Move with substitute, and there was a second? Yes. There's been a motion and a second to report as substituted. Madam Clerk, please open the roll. All righty, that is to report out 5-2. Madam Clerk, please close the roll. Thank you, Delegate McClure.
Thank you, Mr. Chair.
Delegate Gardner. Good afternoon. You have House Bill 283.
I do. Thank you, Mr. Chair. We have, is it one or two line item amendments, if the council would report? One?
Mr. Chair, there's one line amendment on line 93, introduced after provider, insert for opioid addiction recovery.
Is there a motion on the amendment?
Second.
There's been a motion and a second. DLS already explained it. All in favor say aye.
Aye.
All opposed? All right, this is properly before the committee.
Thank you, Mr. Chair. HB 283 removes ambiguity from state law by making it clear that if a pregnant woman is taking a prescribed medication under the care of her physician, that she is not engaged in child abuse or neglect solely for taking that controlled substance as prescribed. According to a recent study, of all the 50 state laws related to prenatal medication for opioid use disorder, like methadone or buprenorphine, Virginia is one of 23 states that do not clearly outline in state code that taking medication as prescribed, like medications for opioid use disorder, isn't solely a reason to consider abuse and neglect of the infant. 25 states have laws clarifying it's not abuse or neglect, and this measure would add Virginia to those states. It also codifies what the Virginia Department of Social Services is already practicing for local departments of social services seeking to determine the validity of child abuse or neglect reporting alleged substance-exposed infants. In the Commonwealth of Virginia, women are pregnant and in recovery for opioid addiction face an impossible decision, Mr. Chair. This issue is driven by the ambiguity in state law that essentially treats any woman who is prescribed medication for opioid use disorder, such as the two drugs I just mentioned because I have a difficult time pronouncing them, when pregnant, as engaged in abuse or neglect of their unborn child. As a result, these women must choose whether to discontinue their medication or run the high risk of addiction relapse and overdose, or face the prospect of having their lives turned upside down and the child potentially taken away from them because they continue to take their prescribed medications. It is so important that we, as I said before, codify this existing practice that the Department of Social Services is already doing. And with that, I turn it over back to you.
Thank you, Delegate Gardner. Any questions from the committee? Delegate Walker.
So, Mr. Chairman, Delegate, I have no problem supporting this. And maybe we can understand when we get to Delegate Hayes's bill, they seem like they're similar. I don't know, has there been any discussion about the two rolling together?
Mr. Chair.
Delegate Gardner.
My bill is more narrowly targeted. It is just for opioid abuse treatment, not the broadness that Delegate Hayes's bill carries. It's very specific and it's solely for this treatment.
Thank you, Delegate.
Thank you. Any other questions from the committee? All righty, turning to the audience. If anyone would like to speak for the bill, please come on by. All righty. I see a group, so you all will have a total of 5 minutes, so please be mindful of the people behind you.
Okay. Hi, my name is Lane Siebert, and I am a person in long-term recovery. I was a heroin addict living on the street when I got pregnant at 19, and like many heroin addicts, I just wanted to die. But then I became pregnant, and my life changed. I knew that I would do whatever my daughter needed to be a good mother, and that the only available option to me, the only next step is to get on to medically assisted treatment for opioid use disorder. In fact, there is no other choice. And the law as it stands presents a horrific choice for women to make. It's really, I cannot overstate how horrible this law is for pregnant women and their babies. This law, it confuses care with surveillance. It criminalizes survival, recovery, and treatment, and it teaches pregnant people that honesty equals danger. Thank you so much.
Thank you.
Mr. Chairman, members of the committee, Robert Melvin with the R Street Institute. We would like to thank the delegate for sponsoring this measure. We think that it's going to do a lot to bring some clarity to an ambiguous law. And in addition to that, one of the things that I think is really important to highlight here is the fact that these medications are considered the gold standard of treatment, whether or not you are or are not pregnant, for their safety and efficacy. So I just want to point that out to the committee and urge you to support the measure. Thank you.
Thank you.
Thank you, Mr. Chairman, members of the committee. Scott Castro, representing the Medical Society of Virginia. We want to thank her, the patron for her leadership on this issue that will surely benefit mothers, newborns, and their families. Thank you very much.
Thank you.
Mr. Chairman, members of the subcommittee, Nicole Lauder with the American College of Obstetricians and Gynecologists. Thank you again to the patron as well. We do support this bill. Our guidance for physicians and their patients is that we shouldn't have any barriers to prenatal and postnatal treatment, and the existing practice law, is a deterrent, and so we support the patron's bill. Thank you.
Thank you. All right, now we will turn to anybody that would like to speak against the bill. All righty, come on up. Ma'am, you have 1 minute.
Hi, my name is Dr. Elise Osterweil. I am a toxicologist and have about 25 years of experience, especially as it relates to fetal origin of diseases and during prenatal exposures. And so I do have concerns about this from professional as well as personal reasons. My youngest brother was addicted to cocaine, and he had lifelong problems related to that. So he's not one and alone. And he was, because, these addictions, it's an insidious, and my heart goes out to these women, but I think this law needs to be amended to be very specific, because I'm not seeing the language here where because it says, prenatal use of a controlled substance or drug as prescribed. But, if it's for the purpose of drug addictions, or now we have, medical marijuana out there and, other drugs, it doesn't even need to be that particular scenario, but I don't see the other exposure scenarios specifically outlined in here.
Thank you. I would like to thank you for your testimony. We have reached your
Okay,
minute.
and so I'm against this because it's just not, the language is not
Thank you.
specific enough.
Thank you. We have no one online speaking for or against the bill, so I will return back to the committee for any questions. Delegate Cohen.
Thank you, Mr. Chair. Not a question, but speaking to the bill.
Go ahead.
I just wanted to thank the patrons so much and thank the folks who testified and were willing to share their story. This is just an incredibly important way to make sure that we don't have babies who are born addicted to opioids, and certainly make sure that we have healthy moms and healthy pregnancies. And I think this is such an important missing piece that we've had. So thank you.
Thank you.
Thank you.
Any other questions? Delegate Gardner for the final word.
I would just like to add, as council read the amendment, it did say for opioid addiction recovery. It was very specific.
Thank you.
Move to report as amended.
Second.
There's been a motion and a second to report as amended. Madam Clerk, please open the roll. Thank you. Madam Clerk, please close the roll. Your bill reports out 4-1 as amended.
Oh, I didn't
do you
vote
want to
for
vote for your own
mine.
bill? Leave the roll open. Oh, no worries. Madam Clerk, please destroy the roll and reopen the roll to report as amended.
I put it up as a minute. 1 second. The motion is to
Just hang on tight, everyone.
There you go.
Oh, there we go.
Oh, that's McClure. Wrong bill.
Wrong bill. 283. We're looking for House Bill 283.
I'm sorry.
Nope, you're fine.
Hang on 1 second.
That was my fault. You know, when you get into a cadence, you open, close the rolls. I need to learn how to leave it open just a little bit longer.
283.
Come right up. 1 second. Sorry about that.
Nope, you're fine.
Report with amendments.
There we go. All righty. Madam Clerk has opened the roll. Has everyone voted who wants to vote? Madam Clerk, please close the roll. This bill reports 5-1. Thank you, Delegate Gardner.
Thank you, Mr. Chair.
Next, we will have Delegate Fagans and then Delegate Tata.
Good afternoon, Chair and members of the subcommittee. I believe I have an amendment. Is that available?
For House Bill 1511?
Correct.
Second.
There's been a motion and second to move the amendment. Would you like to explain, or counsel?
If counsel could explain quickly. Yeah.
Mr. Chair, so the substitute for HB 1511 removes the fund component from the bill, and it adds provision requiring VDSS to implement the Fatherhood Initiative using existing resources and by coordinating state and federal funding sources, programs, and services.
Correct. And so I believe it was a substitute. Yeah, substitute. Not amendment.
So there was a substitute that's been moved and seconded. All in favor, say aye.
Aye.
All opposed? All righty, your bill is properly before us. Delegate Fagans.
Thank you, Chair, members of the subcommittee. After the success of the Momnibus last year, we started the initial steps to build an initiative that focuses on boys, men, and fathers. HB 1188 from Delegate Josh Thomas, the Virginia Boys and Men Advisory Commission, was the first step, and now we have HB 1511, the Fatherhood Initiative. At its core, the Fatherhood Initiative is about strengthening families by ensuring fathers are appropriately recognized, engaged, and supported as partners in their children's lives. It focuses on improving outcomes for children by making fatherhood engagement a consistent, intentional part of how social services system operates. HB 1511 gives the Department of Social Services 3 clear goals. First, it requests that the department create a fatherhood initiative, a statewide effort that recognizes that fathers are essential partners in a child's life and the family well-being, and includes media and educational campaign to better reach and engage fathers. Second, it requests that local social service board to take a hard look at how it currently serves fathers. Each board should complete an initial assessment, develop and implement an action plan to address gaps, and also report on the progress with the department and conduct a review to ensure that fathers are appropriately supported and connected to services. And third, the bill makes clear that the department shall implement the Father Initiative using existing resources by identifying, coordinating, and highlighting state, federal, local, and private grant funds currently available and services that may align with the initiative goals. With that, I hope you to report and support HB 1511.
Thank you, Delegate Fagans. Any questions from the committee? Seeing none, let's go ahead and turn it to the audience. Anyone that would like to speak for the bill? All right, you all have 1 minute each.
Yes, thank you, Mr. Chair. I'm Chris Beach with the CEO of the Fatherhood Foundation of Virginia, and these funds and DSS allocations are definitely needed, as last year when many grants were given to this, they had no identity or clue how to address the fatherhood initiatives, and we came in and trained them, training over 200 people, so it is definitely needed at the state of Virginia, and we want Fatherhood Foundation will completely supports this bill. Thank you.
Emma Johnson. I am the founder and executive director of the Virginia Coalition for Boys and Men, and I'm also the executive director for Moms for Equal Parenting. And for the last 15 years, I have researched, done my own research, synthesized, written books, and consulted on issues surrounding separated families and divorced families. And I fully support this bill. Absolutely supports men and fathers. It's wonderful for children. There are thousands and thousands of pieces of research that support how involved fathers, and programs that support those fathers to become involved fathers are wonderful for children's mental health, physical health, academic outcomes, vocational outcomes, but it's also good for women and moms. In communities where we have involved dads, there's lower domestic violence rates. Ohio State University conducted an incredible piece of research when they studied counties in the state of Ohio where there was more father involvement, there was less child abuse. And where the researchers concluded was that the moms in those communities had more support from the fathers and therefore less child abuse. So therefore, completely support the bill. Thank you.
Thank you. Anyone in opposition? Please come up. You both have 1 minute each.
Thank you. I am adamantly opposed to this bill for reasons that I have already...
State your name or organization you work.
My name is Dr. Elise Osterweil. I am a member of the National Safe Parents Organization, which is comprised of over 100,000 advocates, as well as the individuals who drafted VAWA and the new child safety amendments, which have not been adopted by Virginia yet. I'm also a member of the Virginia Sexual and Physical Violence Action Alliance, who is tracking both of these bills, but they have not released, they're very concerned and they have not released their official opinion yet. Because of the issues related to equal parenting and parental alienation. So I've read some of Emma Johnson's book. I used to be a Facebook page member of her Millionaire Mommy group, and this bill is going to have many unintended consequences. These groups are, organizations that are supporting this are very male-dominated, and the large majority of individuals who support it are white men who have a long history of domestic violence.
Thank you. Thank you. Your time has expired. Next, if you can state your name and organization you work.
I'm Jessica Hopp, and I'm a protective mother. The only thing I have to say is I'd like this bill to be tabled until they can add language that would address child safety concerns. Thank you.
Thank you. Now we will turn online, but I will ask the clerk if we can make sure the buzzer is working so people can, I'm not sure who controls that, but it's not working. So I do apologize. If I have to interrupt you, it's not me. Please blame Delegate Willett. Turning online, we are going to go to Miss Kenda. Did I pronounce that correctly? Birth and Color.
You did. Thank you so much, Mr. Chair and members of the committee. I am Kenda Sentinel. I'm the executive director and founder of Birth and Color. Something that people don't know is that we have a large fatherhood initiative where we support over about 500 fathers every single year, including Dad Self-Care Days. And I'm in strong support of this bill because Black maternal mortality is not just a women's issue. It is a family issue, a community issue, and a responsibility we all share. When fathers are informed, supported, and engaged, mothers are safer, stress is reduced, and outcomes improve. This legislation recognizes that our fathers have long known, what our communities have long known is that our fathers are not optional to family well-being. They are essential partners. By investing in fatherhood education, engagement, and support, we strengthen families before crisis occurs. And I'm in strong support of this bill. Thank you.
Thank you. And then we have another person online for against, Dr. Erica. Is she online? Nope, I don't see her online, but she was speaking in opposition. Alrighty. Turning back to the committee for any questions. Delegate Cole.
I have a question of the patron.
Go ahead.
Is this, I think you said it, but is this going to be a program that falls under the Men and Boys Commission?
Mr. Chair, I will state to the delegate that this is working in conjunction with Delegate Thomas's bill. Delegate Thomas's bill with the commission is more on the executive side. This is more also, while this is assisting in terms of the department, it's more of a complementary to what's going on already with Delegate Thomas's bill.
Thank you. Delegate Walker.
Thank you, Mr. Chair. Thank you, Delegate Fagans, for bringing this bill forward. I know Chris Peace and what they are doing is making a positive impact out here in our society. I think anything we can do to help reunite and keep families together, mothers and fathers are very important to children that are growing up in this world today. Whatever we can do on our side to help further that, I think is a great decision. So, Mr. Chairman, I definitely support this bill before us. Thank you.
Thank you. Seeing no other questions before the committee, Delegate Fagans, you have the last word.
I just want to thank the subcommittee today for allowing to present this. We know that a lot of the outcomes that we're working on, especially as we started last year, working on the Momnibus and how successful it was. This is just the first step to hopefully, as we work with this bill and other pieces of initiative to go on to next year to really show that Virginia is focused on the whole families and getting the best outcomes we can have here in the Commonwealth.
Thank you, Delegate Fagans.
Move to report as amended and refer to appropriations. Second.
There's been a motion and a second to report as substituted to appropriations. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Delegate Fagans, your bill reports out 6-0 to appropriations. Good luck.
Thank you, Chair and committee members.
Next, Delegate Tata. After that, then it will be Delegate Holly Siebel. And you have 266, correct?
Yes, thank you, Mr. Chairman. So HB 266 is a bill that will fundamentally modernize how the Commonwealth serves and protects our most vulnerable children. This legislation creates a single, consistent, 24/7 point of entry for all reports of child abuse and neglect in Virginia. Currently, Virginia relies on a patchwork of 120 local intake processes that vary dramatically from one locality to the next. There has been an intensive analysis by 280 state agencies, stakeholders, and policy experts to improve child welfare in the Commonwealth. One of the primary pillars of necessary reform identified in this study was a critical need for central intake and assessment. Currently, Virginia has an alarming high number of reports of child abuse and neglect that are not pursued by local departments. Statewide, Virginia screens out 61% of referrals compared to the national average of 43%. In 2025, of the 229 child deaths Where there were suspicions of abuse and neglect, a disturbing 23% of those child deaths had a screened out complaint. These numbers reflect a systemic failure to follow up, not a lack of need. HB 266 closes this gap by moving from an inconsistent local system to a statewide unified approach. This bill will ensure uniform standards, immediate accountability, and support for our local DSS caseworkers. Mr. Chair, the current system is not working for our most vulnerable children. Reform is needed, and it's needed now. This legislation shifts our child welfare system towards a timely, proactive, and streamlined approach that will keep more children safe. I ask for your support of 266. Thank you.
Thank you, Delegate Tata. Any questions from the committee? Seeing none, we will turn to the audience. Anyone would like to speak in support of the bill? All right, please come up. Is it just one? All right. 1 minute each.
Okay. My name is Jessica Hopp. As a mom who's experienced the worst failures of the child welfare system, I ask you to support this bill to allow local corruption and bias to be taken out of decisions. Requiring all reports to be entered in the central intake system would mean locals can't just screen things out and patterns are able to be detected. We need a strong system with accountability and oversight every step of the way so that we can do a better job for our children. Currently, mothers who report what's happening to their children with evidence have a 90% chance of losing custody to their abuser, and part of this is lack of accountability and oversight. This bill would be a huge step in the right direction. Thank you.
Thank you.
Good afternoon, Mr. Chair, members of the subcommittee. Eric Reynolds, Children's Ombudsman, and I support this bill and thank Delegate Tata for introducing it.
Thank you.
Hi, my name is Dr. Lisa Osterweil. I'm the founder of Mothers Reform Child Injustices Mercy, as well as a member of the National Safe Parents organization that helped draft the child safety amendments under VAWA. And I am an extremely strong supporter of HB 266. The cognate bill in the Senate, SB 640, already passed with only one dissenter. And so it's a common sense safety, child safety bill that moves Virginia in the right direction. I do have some concerns about how it would be framed, because what happens is in DSS, unfounded cases are actually cases that get mislabeled as unfounded that are actually insufficient information. And so that would be something great to make sure that that goes into the framework. And what happens is when those families go to court and they see that CPS, saw, sexual abuse case as unfounded, that gets translated as false allegations by the courts. And then what happens is, especially in cases of child abuse, the mother, and the child tends to, the child gets 100% taken away from the mother.
Thank you. Anybody would like to oppose the bill? Seeing none, we will turn online. I do believe we have Ms. Dawn speaking for the bill.
Yes, thank you, Mr. Chairman and members of the committee. My name is Dawn Thompson, and I'm currently employed with Grafton Integrated Health Network. I'm speaking to you on the capacity of a former family service specialist that I held at the Warren County Department of Social Services. This legislation before the committee does three things. It helps with the 24-hour response time, state supervision, and centralized intake and validity of referrals being made. Each locality can determine how to interpret and act on policies guidance that is in the manual based on relationships with law enforcement, attorneys, and local court systems. Therefore, this legislation would decrease misinterpretation. The size of the locality plays a part in response times and interpretation of the policy. Given that there is a significant turnover with employees from family service specialists, supervisors, and directors, this would take out any misinterpretation of the guidance and the policy.
Thank
During
you,
my
Ms.
time
Bond.
as a family service
you.
specialist, time's up. I'm sorry.
You are fine. Thank you. That is all the testimony. Returning back to the committee for any questions. Seeing none, Delegate Tata, you have the last word.
I just hope that you will approve this. This is really important legislation, and I just think it's time. The time is now, and it would be great to see this go through. Thank you.
Thank you. Turning back to the committee. Delegate Cornett.
Mr. Chairman, I have a motion when appropriate.
Go ahead.
I move to report and refer to appropriations.
Second.
Mr. Chair, I have a substitute motion when appropriate.
Delegate Cohen.
I move to gently lay it on the table because we do have a bill that Delegate Tran has, 1490, that does take up the centralized intake piece. So I would move to very gently lay it on the table.
There's been a motion and a second. That motion has a higher weight, and I do believe that it's a recorded vote. So, Madam Clerk, please open the roll to gently lay this on the table. Madam Clerk, please close the roll. Delegate Tater, your bill has been tabled 3-2. Thank you so much.
Thank you.
Delegate Siebold.
Good afternoon, Mr. Chair.
Good afternoon. You have House Bill 297.
Yes, I do.
All
Thank you,
right,
Mr.
go
Chair.
ahead.
All right, thank you, Mr. Chair. HB 297 establishes clear, common sense disclosure requirements for residential referral agencies that may assist seniors and families in identifying assisted living facilities. The substitute before you, which I move.
You have a substitute?
I do. Just remembered.
So moved.
There's been a motion. Is there a second?
Second.
There's been a motion and second. Would you like to explain the substitute or counsel?
The substitute, Mr. Chair, is pretty much the entirety of the bill. So if it was okay with you, I'll just continue explaining the bill. Okay, thank you, Mr. Chair. The substitute focuses on transparency, resident awareness, and enforceability. Resident referral agencies are currently unregulated in the Commonwealth. Families and loved ones are often working to place an aging parent, spouse, or family member into an assisted living facility under significant time pressure and stressful circumstances. In these moments, residents and families may rely on resident referral agencies without being fully aware that a contractual or financial relationship may exist between the referral agency and an assisted living facility. Because prospective residents are not parties to those contracts, HB 297 is narrowly focused on ensuring informed consent by requiring clear, upfront disclosures. Happy to answer any questions from the committee, Mr. Chair. Thank you.
All righty, thank you. Any questions from the committee? Delegate Cohen.
Thank you, Mr. Chair. Question of the patron?
Go ahead.
In looking at this, and I know you have done so much work, this bill does not even resemble, I think, the original, and I certainly understand the intent. But I did have a few specific questions, and these may be phone a friend kind of questions. But the first is it the potential resident or who becomes the resident of the assisted living, is that who pays the referral fee?
Mr. Chair, thank you for the question, Delegate Cohen. If it was okay with you, Mr. Chair, I'd like to call up a representative for the Virginia Association of Assisted Living to answer the questions in more detail.
Good afternoon. My name's Judy Hackler, and I'm with the Virginia Assisted Living Association. And the referral fee is actually paid by the assisted living community directly to the referral agency. The resident or prospective resident does not pay directly of the referral fee. But as you know, any operational cost in a business that does have customers, it does eventually get calculated into the overall operational cost. And so especially if an assisted living community is paying multiple referral fees, then they would eventually be calculated in the base cost of rent and for the resident.
Delegate Cohen.
Follow up, Mr. Chair.
Go ahead.
Sorry, you might want to stay there. I so appreciate it. So what you're saying is, no, it is not directly paid by the resident, it's paid by the assisted living. But you're saying somewhere along the way, ultimately, fees would be increased over everyone or over that specific resident?
Most likely it would be put into the total equation of the operation. It would not go directly to that resident. Most of the communities will have a base level service fee that they provide, and then dependent upon what the individual needs of the residents are, what their level of care are, and their specific services, then there may be a cost of care for level of care fees.
Delegate Cohen, any?
I'm
Okay,
good, thank you.
all right. Delegate Walker.
Thank you, Mr. Chairman. Certainly there is a lot of assisted living across the Commonwealth here, and there's a lot of marketing that goes on among these. I see it on TV, hear it on radio and things like this. To me, from where this bill stands at this point, it seems to be more of a consumer protection for the individuals that are looking for a facility for assisted living. So I'm comfortable in supporting this bill. I work with some assisted livings in my area, and I know there's always been many concerns about the marketing and approaches and things like that. So this I see as more of a safeguard, consumer protection, and anything we do for our senior citizens or people going into assisted living, I think is a positive step forward. Thank you, Mr. Chairman.
Thank you, Delegate Walker. Delegate Shin.
Thank you, Mr. Chair. If I might ask, from like a user experience perspective, if I am going to a resident referral agency, that might be a website, but that might not be a website. And so at what point am I, as the user seeking an assisted living facility, at what point am I getting this disclosure, and what qualifies as receipt and or confirmation of said disclosure?
Mr. Chair, I'd answer the delegate. At this point, there isn't a way to commit to that, to receiving that disclosure, which is really what we're trying to target with the bill. But I can also call up my expert witness, as I mentioned, who may be able to walk you through that a little more closely, if you'd like, Mr. Chair. Is that okay?
That is perfectly fine. On the front.
Again, Judy Hackler, Virginia Assisted Living Association. And with regards to that, since this is an unregulated industry, right now it is a business practice for each of the referral agencies to decide how they're going to disclose their services, as well as any fee structure and how it's being paid. It's an individual choice. As you mentioned, it could be a search online for online referral agencies. It can also be in-person local senior living referral agencies that are going into the communities. And so there's different options that the resident or their family member could choose in order to search for the community. And then as they are going through the process and determining what the needs are, dependent on each referral agency, that will then decide what information they provide back to the resident. There is no required information that has to be given right now.
Delegate Shen.
Sorry, Mr. Chair, can I clarify what that meant? There's no requirement to give that information right now?
Right, because it's an unregulated industry, so it's just a business practice of what information that they provide to the resident and their family members seeking the services of the referrals.
Delegate Shin.
Mr. Chair, I think that what I'm understanding then is that this substitute is trying to put into place some disclosure requirements around what will be presented now, that because that doesn't exist in current practice, but there's no in other places where we've seen disclosure requirements like this, usually we put into place like a mechanism or details around how it's delivered. How are you supposed to confirm or affirm that the person has received it if it hasn't been received? And like, how do you clarify that? So those are still unanswered questions for me.
No, Mr. Chair, I think she had another friend saying yes.
So we've had several people, sorry for the multiple people. We've had, Mr. Chair, we had several people working on this bill. So there's a coalition. I'd love to call up another member of that coalition to answer that question as well.
Mr. Chair, Ben Trainum, representing the Virginia Healthcare Association and Center for Assisted Living. We represent the larger assisted living facilities in the Commonwealth. Mr. Chair, I would answer Delegate Shin's question. That is something specifically that we have been negotiating up until literally about 2 hours ago in this legislation. And the way that we have it drafted, and there may even be a line amendment at full committee, full disclosure, just so we have, our full understanding and agreement here with the other stakeholders in the legislation. But basically what we would have it do is require the resident referral agency to retain a proof, essentially, of that the disclosure was provided to the resident. And that's what will be required once we hopefully work it out for the full committee.
Delegate Shin.
Mr. Chair, it sounds like then maybe there's another amendment that's potentially coming that would clarify confirmation or mechanisms in which to confirm said disclosure.
And Mr. Chair, Delegate Shin, that is correct. Right now, the substitute language, and I don't have it in front of me, but right now I believe it says that the agency would be required to obtain acknowledgement from the resident, and I think we're changing that to retain proof of providing that acknowledgement or that disclosure. So it's a little bit of a nuance in the language, but that will be hammered out in the end.
Got it. Mr. Chair, if I might ask another different sort of line of questioning. In thinking through this bill and like the original version and now the substitute, some other questions have come up. So, which has to do with like the consumer protection piece of it. If it's about a consumer, like the user that we're trying to protect and create guardrails for, I wonder about like contact and information requests made of the resident referral agency. I wonder how long the resident referral agency is permitted to keep that data, especially if that resident referral agency is a website.
Mr. Chair, Delegate Shin, I would defer to resident referral agencies to answer that question, and that may be required in other data protection statutes as well.
Thank you. Any other questions? Delegate Walker.
So, Mr. Chairman, picking up on Delegate Shin's comment there about consumer protection, I think any time that you can have full disclosure and whatever agreements you come to with the amendment there is certainly in the best interest of all the parties involved there. And I think that the more information that say the individuals that are going into assisting or shopping for assisted living knows and understands is important, because it is a major decision when they a major financial decision. So that's the reason I referred to consumer protection earlier. Because this is an investment that is going to be, I don't know how long, but the assisted livings, we also want to make sure that they are operating not only under the guidelines of consumer protection, but full disclosure of everything, because the marketing is pretty intense out here. And sometimes people get confused on making decisions here. So I think the more information, more disclosure. As far as record keeping, I don't know, I think that's more of a business decision that they have to determine. But I think we're moving in the right direction and trying to offer some protection here. Thank you, Mr. Chair.
Thank you, Delegate Walker. Delegate Shin.
Thank you, and sorry, Mr. Chair. In my head, this referral agency is like a website, right? And so if I'm going to Google and I'm typing in assisted living facility, and I get a bunch of results. The top results that I might get are the ones that are sponsored and paid for by an ad, and it usually is marked that way. But we're saying that for these referral agencies that might be online, that might be like a digital platform, we're saying that they have to make similar disclosures of compensation that they might be receiving from the assisted living facility that's being advertised or promoted on that site. But I'm wondering if there are other places in code in which we create these disclosure requirements, because I do agree that these kinds of disclosures and transparency about where are you getting your funding from, how are you being compensated, what kind of relationships might exist in which you have a financial interest in promoting said assisted living facility or not. I wonder if that kind of consumer protection exists for other referral agencies that might not necessarily be for assisted living facilities. And I wonder if council knows what that looks like.
Council.
Mr. Chair, to answer Delegate Shin's question, so with regards to referral agencies specifically, I don't believe that there's any provisions in the code that refer to other referral agencies having any sort of disclosure requirements that we enumerate. I don't believe so.
Thank you, Council.
Now we are going to turn to the audience. If there's anyone that would like to speak for the bill, please come forward. All righty, you have 1 minute each.
Good afternoon again. Judy Hackler, Virginia Assisted Living Association. We have communicated with many assisted living communities across the Commonwealth, as well as multiple senior living referral agencies, as well as many individuals that serve as caregivers looking for care for their loved ones in order to try to figure out what is the best consumer protection, informed disclosure, whatever terminology it needs to be to inform them of how this search is being paid for, that the advertisements, a lot of times you see are free, but in a lot of times it's being paid for elsewhere. And so we thank the patron for caring for the seniors and for the adults looking for this type of care. Usually they're doing this in distress, and so they're not reading all the fine prints that might be at the bottom of a website, or they may just be flipping the pages if they're doing it in person as well. And so I know that we do have some other individuals that want to speak in support. We've also spoken with the state long-term care ombudsman who's in support of this, as well as other individuals and agencies. And so thank you for considering this.
Thank you. And if we can scoot up a little bit closer, Delegate Walker gave me a time frame.
Good afternoon. My name's Lisa Isbell. I'm the owner of Senior Care Authority, a local elder care consulting and placement company, which I opened in 2017. I also serve as the president of the Richmond chapter of the National Placement and Referral Alliance, or NPRA. NPRA is a national trade organization for local placement agents. Members of NPRA strongly believe in ethical, knowledgeable, and professional business practices in working with older adults and their families. All NPRA members agree to follow stated best practice guidelines as well as a code of ethics in operating our businesses. NPRA has been a long proponent of transparency and the right of families to choose which company, if any, they want to work with to help find care and living options for a loved one. This practice is referred to as family choice, and NPRA has been instrumental in helping get legislation passed in several states to promote these goals. I'm here today representing myself as well as representing NPRA to support passage of Bill 297.
Thank you. Thank you.
Thank you.
Good evening.
Good evening.
I'm John Krug. I'm the owner of Oasis Senior Advisors. I'm a credentialed certified senior advisors. Families facing the search for assisted living and memory care, as Ms. Shin and Mr. Walker have indicated, it's one of the most emotional decisions that a son and daughter will ever make. Yet the industry that they walk into is often noisy, inconsistent, and frankly not designed for the family's best interests. You have the online digital juggernauts that will simultaneously send 15 communities to a client, and then they send the phone numbers there. And 297 is a bill in the right direction.
Thank you.
Mr. Chair, members of the subcommittee, Ben Trainum with Hancock, Daniel, and Johnson on behalf of the Virginia Healthcare Association and Center for Assisted Living. Appreciate the patron, appreciate the stakeholders for all the hard work. Like I said earlier in response to Delegate Shin's question, we have been working hard on this, and we have, up until very recently this afternoon, been working on language and have an agreement, hopefully with everybody involved to move forward with this, and appreciate all the work that's gone into it. Thank you.
Thank you. Anybody in the room to speak against the bill? Oh, you're for? Neutral? Okay.
Mr. Chair, can I speak from a neutral posture?
Yes,
Thank
yes,
you.
you have
Nicole
1
Brenner
minute.
with Seven Hills Strategy Group on behalf of A Place for Mom. Understand that this has gone by for a few weeks, and we appreciate the time to work it out. Our neutrality is contingent upon the language that Mr. Trainum mentioned being in the bill, and I understand it is not in there right now. A Place for Mom is the leading platform or website that helps guide families through the sometimes many years process of deciding where their loved ones will be. You would find the disclosure on our website that we are paid by the assisted living facilities. We do not have an arrangement, a contract, or an agreement with the residents, which is why we expressed concerns with those provisions of the introduced bill. Happy to answer any questions. Thank you for your consideration.
Thank you. Anyone against? All right, seeing none, we are going to turn online. We have Mr. Irvin. I don't think he's online. Mr. Irvin was speaking for your bill, Delegate Siebold. Now, returning to the committee for any questions, Delegate Cohen.
Thank you, Mr. Chair. More of a speaking to the bill than a question.
Okay.
I just wanted to also sort of level set, as somebody whose dad had Parkinson's for 27 years, we didn't know what to do when his care needs were well beyond our capabilities, probably truthfully for a whole lot longer than he was in the assisted living. And we did go to a website to even know what the possibilities were, know that we needed a place that was going to have memory care as a subset of what they did, because maybe he didn't need it yet, but we knew that he would. And so for us, it was hugely helpful. So I just don't want there to be a perception out there that that these are not helpful in the same way that you use Angie's List or you use other referral websites. Maybe it's AAA when you're looking for a vacation, which sounds so good right now. But we really did find this to be a very useful tool with my dad, and found third time was the charm, but ultimately the perfect place for him. And we were forever grateful, because it was destroying our family. So I want us to get this right, which is why I so appreciate the patron and your willingness to work with me. I have been an absolute pain in the tush about this one, but I want us to get it right, because I think there is a balance there. So when it's the appropriate time for a motion, I'd like to make one.
Okay, we're going to go to Delegate Walker, and then we're going to give the delegate the last word. Delegate Walker.
Thank you, Mr. Chairman. I think this bill is moving in a good direction. Obviously, you guys have put a lot of hard work into it. At the end of the day, it is about the consumers, the individuals out here, and ensuring that they're getting the best protection and whatever choices they make, and the transparency is important there. Mr. Chairman, I would move that this bill go forward.
Was that
that's a motion? Move to report. I apologize. With the substitute.
Substitute motion, Mr. Chair.
Delegate Shin.
I'd make the motion that it seems, and I'd make the motion that we carry this over to 2027. And if I may speak to that motion briefly.
Go ahead.
It seems like, as Delegate Cohen has said, there is still quite a bit of thought that needs to still be worked out, and some kinks here. I also want to express a lot of gratitude to Delegate Siebold for being tolerant of all of my questions this afternoon, as well as here in this committee. And so my motion, Mr. Chair, again, is to continue this bill to 2027.
There's been a motion and a second to continue to carry. This is a voice vote. All in favor say aye. Aye. All opposed? Delegate Siebold, your bill is continued to 2027.
Thank you so much, Mr. Chair and members of the committee.
Thank you. And just to level set the agenda, next is Stacey Carroll. For the other delegates, Delegate Carlson, Delegate Cole, Delegate Kent, which ones have subcommittees that they really need to get to so I can? So I'll do Delegate Cole next, Delegate Kent next, and then Delegate Carlson. Is that okay? She's in the back. All right.
Yes, so good evening, Mr. Chair and members of the committee. I'll start with HB 1174.
1174, go ahead.
Yes. You all know me as Delegate Stacey Carroll. What you might not know is that I have been serving you for the last 7 years here in the Commonwealth, partnering with my local localities by being a foster parent. My specialization has been teens. When somebody asks me, Stacey, how many kids do you have? I say 25. This past May, I graduated 2 kids out of foster care. One I dropped off at college, the other one I dropped off to a trade school, I am here because as a parent with 4 graduates in my house, things can be very expensive. Currently, the annual supplemental clothing allowance for a child in foster care here in the Commonwealth is $581. I'm going to say that again. The annual clothing supplemental allowance for a child in foster care ages 13 to 18 is $581. My recommendation is that we increase that by 30%. I'll tell you personally, I've had children in my home that is under the care and the direction of the Commonwealth of Virginia that wears 4X size 15 shoe. That $574 required me as a parent, because I am a parent of every child that comes in my home, that I utilize my own funds. All foster parents can't do that. They don't have that necessary capability. Some of our children we know that are in foster care may be inside of various institutions and or group homes to where that loving support and additional financial support is not available. I am asking for the consideration of the committee that we take care of the kids that are in our care and custody by putting our money where our mouth is and making sure that as kids age out of foster care or currently in foster care, they are clothed to the best of their ability so that they can go to school and do what we require them to do to learn and be good products of this society.
Thank you, Delegate Carroll. Now I'm turning to the committee for any questions. All right, Delegate Walker.
Thank you, Mr. Chairman. Delegate Carroll, God bless you for doing what you do in foster care. And I understand that you're pretty good at math, too.
Yes.
So I do have a question for you.
Yes.
And sometimes my hearing is a little bit slow, but could you tell me what 30% of what the total cost would be if we increased it by 30% to what you're currently receiving?
So if you increase the total dollar amount specifically from, let's just say a teenager, from $581, it would go up to $755. If we did it for all the children, and currently right now here in the Commonwealth of Virginia, there's over 7,000 children. As of December 2025, there were over 7,000 children in foster care, and of that, 2,000 of those children were between the ages of 18. The total fiscal impact for this 30% increase would be nearly $1 million.
$1 million.
Delegate
I think that's all at this point, Mr. Chairman, and thank you for the answer response.
Thank you. Any other questions from the committee? Mine is just a statement. I just want to thank you for being a foster mom. My mom is a foster mom. I got 4 brothers that we have adopted, and they have been eating my wallet. And if it's not my wallet, I think they just asked me for prom and tux and shoes and everything else. And I'm like, I'm only a delegate. Turning to the audience, is there anyone speaking for the bill? For the bill, I see 3. Anybody else so I could gauge the time? Okay, 5 minutes total. Please be mindful of your time.
Good afternoon, Mr. Chairman and committee. My name is Lawrence Webb. I'm from North Virginia in Fairfax County. I am a current foster parent over the last 5 years with kids ranging from 5 months to a 15-year-old. She is 100% correct. I and my partner are in a position to supplement that cost to those children and what they need. Many people are not, so I just want to definitely support your bill.
Thank you.
Hi, my name is Dr. Elise Osterweil. I am the founder of Mothers Reform Child Injustices, and I'm also a former foster child. And for as long as I can remember, aged out of the system since my mother refused to give me up for adoption. But then my foster parents loved me because I was straight A student, very well behaved, and used for labor purposes in the foster care system and never received 1 penny for clothes. I was had to go clean trash cans and forced to work to pay for my own clothes. So I promised myself whatever job I get in the future that I would never be dependent on a man. And here I am homeless again. Thought my PhD would protect me and provide immunity from that, but it doesn't because our justice system is broken, DSS is broken, and this fatherhood initiative is going to make it worse. So thank you. Make sure that those children know about that money, because I had no idea that my mother was receiving, in New Jersey, it was like $100 a month or something more. And that was back
Let's
in the 1980s.
remember to speak directly to the chair.
So thank you. Make
Thank
sure
you.
the children know that they're getting this money.
Thank you.
Hello, Jordan Roberts with Voices for Virginia's Children. I'm testifying in support of HB 1174, which increases the supplemental clothing allowance for children in foster care. Current allowances have not kept pace with the rising cost of clothes, shoes, and seasonal items like coats and boots. Foster parents consistently report that clothing allowances don't adequately cover children's basic needs, forcing families to absorb costs out of pocket. Increasing this allowance ensures children in foster care have appropriate clothing for school, activities, and daily life, meeting their basic needs with dignity. We urge your support and thank the patron for her.
Thank you.
Mr. Chair and members of the committee, Valerie LaRue, Center for Family Advocacy at Virginia Poverty Law Center. And for the reasons stated by Voices for Virginia's Children, we also support this bill. Thank you.
Thank you. Anyone speaking against? Seeing none, we have no testimony online. We return back to the committee for any questions.
Move to report and refer to appropriations. Second.
There's been a motion to report and refer to appropriations. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Delegate Carroll, your bill is recommended to report and refer to appropriations 7-0. Your next one, House Bill 1297.
Yes, 1297. I've been working with foster care. We have a great program in place for children, but not adults. Specifically speaking, Adult Protective Services is managed by the Department of Aging and Rehabilitation Services, better known affectionately to me as DARS, and administered by the local Department of Social Services. While there are mechanisms in place to investigate and protect and provide services to the vulnerable population of adults, there are currently no provisions under Virginia Code for the cataloging adult abuser information similar to that of the Children's Central Virginia Registry, where a child abuse and neglect perpetrator's information is kept. I say that because on so many levels, we think about how people are serviced or how we're servicing in the community. As a parent that had a child in care that aged out, I needed to go find someone to assist me. My placement aged out of foster care and was still with me because I just loved my baby. But they needed additional services that, because they were over the age of 18, required different steps. As I looked to find a particular person or registry to help support me, there was not a place for me to go that exposed a particular person that has abused and or done something that violated a particular person in his previous edition. I can give you various examples to say just quickly. If a family member or a person has served as a paid Medicaid caretaker for someone, at that particular time while under their care and due to neglect, that patient passed away. The caretaker was found to be criminally liable for the patient's death and had to serve time in jail. His plea agreement prohibited from him serving as a caretaker. However, without a central registry and the absence of any criminal history check, this individual could once again become a caretaker. I say that because as the population of those most vulnerable among us, whether that be the aging and or the disabled, there isn't one place for people to go to confer the person that we're hiring and or utilizing to assist us, or even employers to be able to say this particular person in the past has done something that would prohibit them or preclude them from being able to serve this particular population, hence moving forward. That's why I would ask for the committee's consideration on establishing a central registry on behalf of the Commonwealth of Virginia, to where myself as a general user and or employers can go to be able to confirm that there has been an reported and founded case of abuse for this particular vulnerable population.
Thank you, Delegate. Turn into the committee for any questions. Seeing none, turning to the audience, if anyone would like to speak for the bill. please come up. I think there's
Hello.
3, so 1 minute each.
Yes. My name is Virginia Ferris. I'm with the Disability Law Center of Virginia. DLCV receives thousands of incident reports annually from mental health and developmental disability service providers, as well as from adult protective services. Mr. Chair, I understand that an abuse neglect registry is a serious undertaking, but I want this committee to understand exactly what is at stake. It is far too common for abusive caregivers to immediately be rehired by other providers. Background checks should theoretically fill this niche, but we know they do not. Perpetrators can simply leave a job off their resume, and if they don't want an employer to know about their wrongdoing, they won't. Barrier crime laws should help fill this niche, but again, police so commonly refuse to charge these crimes even when there is clear evidence. An abuse neglect registry would help providers understand who they're really working with, and we strongly believe it would increase safety and trust. As we speak, the Commonwealth is allowing repeat abusers to hurt our most vulnerable Virginians. That has to stop. We ask that you pass this bill.
Thank you.
My name is Dr. Elise Osterweil, and because of my PTSD and the trauma of I have a rare neurological disorder. That's why I wasn't able to come earlier today, because I get trauma-induced seizures. And I agree, we need this law because I was in the hospital for seizures, and a nurse punched me while I was in a seizure, and I came to, and because of my PTSD, I get it triggered my PTSD because of the physical assaults that I've experienced in the past. And so then I woke up and I didn't know where I was. And so I pushed her back. And then I'm being accused of assaulting a nurse because she punched me. This also has happened to my mother as well in the ICU. And so.
Thank you. Thank you.
Yes, thank you.
Good evening, Mr. Chair, members of the committee. My name is David Mark Whitley. I'm Deputy City Manager of the City of Fredericksburg. The City Council of the City of Fredericksburg has asked to include this in their legislative agenda to have a APS registry, an Adult Protective Services Registry, similar to the Child Protective Services Registry that the Commonwealth already has. And we believe it's a wise and prudent use of resources to potentially protect our most vulnerable Virginians from harm. So we humbly urge your favorable consideration of the bill.
Thank you. Now I'm turning for anyone who would like to speak against the bill. Seeing none, we do not have testimony online. Delegate, I'll give you the final word because I'm realizing they like making motions quick. So
no worries. There is a Mr. Chair. There is a substitute.
Oh,
I accept committee move substitute.
Move the substitute. Second.
There's been a motion and a second to move the substitute. Would you like to explain it or counsel?
Counsel.
Mr. Chair, substitute for HB, 1297. We're changing the name of the registry to the Adult Protective Services Central Registry throughout the bill. It also adds a provision that records maintained in the Adult Abuse, Neglect, and Exploitation Information System are purged 5 years after case closure unless the perpetrator remains in the registry, and it adds the word intentionally to the definition of adult neglect, so intentionally not being provided services instead of just not being provided services. It also makes several technical changes throughout, but I believe that those are the substantive changes in the substitute.
There's been a motion and a second on the substitute. All in favor say aye.
Aye.
All opposed? Substitute and the bill is properly before us. Now questions from the committee. Delegate Cole.
Yes, a question, Mr. Chair,
Go
question
ahead.
to the patron. For the central registry, will this, what's the breadth of what will be reported? Is it complaints as well as incidents reports as well as criminal background on the registry?
So no, the registry generally would only report cases that are founded, and it would be similar to that of the Child Protective Services Registry.
Any other questions before the committee? The committee operates by motion. If you do make a motion, it is to go upstairs to appropriations as substituted. There's been a motion and a second to report as substituted and refer to appropriations. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Delegate Carroll, your bill reports out 5-1. Thank you so much.
Thank you so much.
Now, according to my cheat sheet, we have Delegate Cole of Fredericksburg. Which one is Fredericksburg and Spotsylvania? It's Fredericksburg. Delegate Cole of Fredericksburg.
Thank you, Mr. Chair. Before you is HB 1434. This particular bill addresses a major but often overlooked driver of poor health in our Medicaid population, lack of reliable access to nutritious food. Many Virginians on Medicaid live with diabetes, heart disease, kidney disease, and other diet-related chronic conditions. The doctors prescribe treatment plans that assume patients can afford healthy food, and too often that is not the case. Many live in food deserts, rely on convenience stores, or lack the resources to buy nutritious meals. When people cannot follow basic nutrition guidance, their conditions worsen. That leads to more emergency room visits, more hospitalizations, and higher long-term Medicaid costs. We are already paying for the consequences of poor nutrition through preventable complications and repeated hospital stays. This bill allows the Department of Medical Assistance Services, with federal approval, to cover evidence-based nutrition services, including counseling, medically tailored meals, and food prescriptions for individuals with nutrition-related chronic diseases. The goal is to treat food as a part of healthcare and intervene earlier before conditions become more severe and more expensive to treat. I hope it will be the pleasure of the body to report the appropriate committee.
Thank you, Delegate Cole of Fredericksburg. Now turning to the committee for any questions. Seeing none, we will turn to the audience. Anyone like to speak in support of the bill? All right, anybody else? All right, I see 3, 1 minute each.
Thank you, Mr. Chair. Good evening, committee members. My name is Eddie Oliver. I'm the Executive Director of the Federation of Virginia Food Banks. Chronic disease is really a crisis in Virginia that's being fueled by increasing food insecurity rates. We now have 1 in 8 Virginians and 1 in 5 Medicaid members who cannot consistently afford nutritious food. Research has shown that people who are food insecure are at greater risk of developing the most costly chronic diseases such as hypertension, diabetes, heart disease, stroke, and cancer. Over 20 other states have implemented Medicaid reimbursement for food as medicine initiatives, and we now have a very strong evidence base to show the efficacy of these programs. Furthermore, the prioritization of using locally grown food in these programs will strengthen our regional agriculture economy as well. So we ask that you support the bill. Thank you.
Thank you. Please come on up.
Good afternoon. My name is Cheryl Garland, and I serve as the Chief of Health Impact for VCU Health System. Thank you for the opportunity to express support for the Food as Medicine Bill, HB 1434. VCU Health is the largest safety net health system in the Commonwealth, with over 62% of our patients being uninsured or enrolled in government-sponsored programs such as Medicaid and Medicare. Research has shown that individuals enrolled in public insurance programs and those with lower socioeconomic status often experience poorer health outcomes than those with other types of insurance. It has also been documented that health-related social needs, such as food insecurity and housing instability, are contributing factors to these disparate outcomes, and in some cases, higher costs. In calendar year 2025, approximately 10% of the 27,000 inpatients screened at VCU Medical Center and the Children's Hospital of Richmond responded that they were experiencing food insecurity. To address this issue, we've built strategic partnerships with food banks and community organizations to enhance access to food for our patients and their families, and we would like to wholeheartedly support this, and your support of this bill is greatly appreciated.
Thank you.
Hello, Mr. Chair, members of the subcommittee. My name is Chloe Edwards. I'm the policy director at New Virginia Majority, as well as the co-executive director of Transformative Changes, who are both supportive of this bill. We know that across cultures, food has long been used as preventative medicine. The Mediterranean diet supports brain health and reduces dementia. Foods like broccoli and other cruciferous vegetables support hormone balance and can help conditions like fibroids. Turmeric, ginger, and magnesium helps reduce inflammation. Oftentimes, families can solve the root cause of whatever nutritional deficits they have fresh and nutritious foods rather than taking ongoing prescriptions. For those purposes, we're supportive of this bill. Thank you.
Thank you. Are you speaking for or against?
For.
For, okay.
My name is Dr. Elise Osterweil, and I'm speaking as a domestic violence survivor who have FND because of the first seizure was when my ex-husband had kidnapped me in 2015 and then said that I'd never see my daughter again if I didn't do exactly as he said. And so June 2022, I was accused of kidnapping my child, and then it triggered the seizures again, over and over again, but he started hacking into my phone over and over again. He's a professor of cybersecurity. And he just sent well, I don't know if it's him, but I'm 99% sure it's him, and sent a death threat 3 weeks ago, right? And then so those triggers my seizures. And so I've been in the hospital in and out countless times. I don't even know. I think in a report it was like 6 times in 24 hours over New Year's Eve, and these hackings tend to coincide. But I wasn't able to hold a bottle of water.
Thank you.
Eat, and we need this.
Thank you. Thank you. Do you need a medic? Oh, the committee will go at ease. thank Capitol Police. Now I can hear myself. I'd like to thank Capitol Police and the first responders. That was something that we have not witnessed before, but their quick and swift response, and Delegate Cornett and DLS and staff and the clerk, I just want to thank you for the hard work that you have done. I do know that sometimes when we are telling our stories, you know, it can get our heart flustered and things happen, but I do want to thank everyone in this room for remaining professional, and our Capitol Police, our first responders, and everyone involved. And with that, we were still on House Bill 1434, finishing testimony, and we were returning back to the committee. Any other questions from the committee?
I have a motion when you're ready, Mr. Chair.
Delegate Shin.
Thank you, Mr. Chair. I'd also like to shout out our clerk, Clerk Ash. Her 33 years of training as an EMT meant she leapt into action more quickly than any of us could even process what was happening. So thank you, Madam Clerk, for your work here in many regards. And so my motion, Mr. Chair, is to report, was there an amendment? No. Report and re-refer to appropriations, Mr. Chair.
Second.
There's been a motion and a second to report and refer to appropriations. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Delegate Cole, your bill reports out 62 to appropriations. And now the proper chair of this committee is back, so I will go ahead and turn the gavel over.
Thank you. Thank you so much, Delegate Henson, and I really appreciate you, members of the committee, our incredible team, and just want to thank everybody who is in the room right now. And I hope with these long days, and they will continue in the next, as we head into crossover, that you know, we all are able to catch our breath and take care of ourselves and reach out if we need some support in doing that. All right, I see Delegate Delaney. We have House Bill 1222 in front of us.
Thank you, Madam Chair. House Bill 1222. This is otherwise known as the Gracie Act. It would define a child welfare interview as documented interview with all relevant parties conducted by Child Protective Services, which is CPS, in order to elicit information regarding concerns of abuse, neglect, or exposure to violence. The legislation also requires local law enforcement to video or audio record any and all child welfare interviews. So we know that 37.4% of children will be interviewed by CPS before the age of 18. Despite this, current CPS interview protocols are outdated and require reform. Unrecorded interviews obscure transparency, and having this act in place will help make everyone more accountable. So the Gracie Act will allow for child welfare interviews to be conducted by local departments to help determine the immediate safety for a child in order to prevent further abuse or neglect. Additionally, this bill will enforce the use of audio recordings, bringing Virginia in line with DOJ procedure. The federal legislation that this act is based on consists of a federal grant program as well to reward states that require recording of all child welfare interviews and supports these states in recording and securely storing these interviews for at least 5 years. So this bill implements the federal procedure into state law and is based off of pre-existing state codes regarding child abuse investigations that have been further tweaked in order to continue protecting the rights of children who are at risk for potential child abuse situations.
Thank you so much, Delegate Delaney. Are there any questions from our subcommittee members? I don't see any hands up. Or are there any folks who are in the room to support House Bill 1222? Okay. Are there any folks in the room? Oh, are you coming up? Come on up.
Good afternoon, or good evening now. My name is Jessica Hopp. As a domestic violence survivor who fled due to what was happening to her children, I have learned the hard way that CPS needs accountability and transparency. This bill provides one way to create that so that records have a better chance of reflecting accurate information. Too often, the information in reports is not accurate, and it harms both parents and children. Too often, parents are told one thing, and then it is twisted. Every step we can take towards transparency is a step towards ultimately helping children. Thank you.
Thank you very much.
Are there any folks in the room who wish to speak in opposition to this bill? I don't see any folks. We have one person who signed up online to speak in favor of the bill. Anne, are you still with us? Thank you.
Yeah, I'm still here. Thank you so much. Well, thank you so much, Delegate Delaney and members of the committee, for your willingness, first of all, to prioritize child protection. My name is Ann Basham. I am the CEO of Ascend Consulting, and I'm here representing Street Grace, which is an anti-child exploitation organization. I'm also the former senior advisor for the Office for Victims of Crime at the Department of Justice. I'm going to start with the story that represents one of thousands, which would have ended very differently had this bill been in effect. Gracie, as I will refer to her, was a young girl caught in a nightmare that too many children face. Her parents were divorced, actually due to domestic violence, as the woman before previously mentioned. During a visit to her father's house, a quarrel escalated into physical violence, and her father grabbed her neck, something which would have been a felony here in the Commonwealth of Virginia, and statistically is a likely predictor of future fatalities, actually. The incident was reported to a counselor by the child, and the case was referred to CPS. The CPS caseworker interviewed Gracie at her mother's home because school happened to be closed that day for snow. The mother overheard Gracie's testimony from the next room, so she was shocked when the case was curiously dismissed several weeks later. Months after the family assessment was closed, it was discovered that the official report distorted the little girl's testimony, because you can actually order a copy of that if it's just a family assessment and you're not the one under investigation. It downplayed the assault to a mere grab of the arm, not the neck. Gracie's testimony and her voice were silenced, so what she said was never accurately reported. As Delegate Delaney mentioned, 37% of children, more than 1/3 of children in the United States, are interviewed by CPS before they're 18. And additionally, because I know there were several bills that address this today, I do want to say that according to a very recent Department of Justice and George Washington University study, mothers who report the abuse of their children by the father are 80% more likely to lose custody of their children. And this is another reason why we believe that child testimonies need to be recorded accurately to reduce trauma as well to the children because of repeated interviews that happen unnecessarily. And the last thing I'll say, because I know we're really short on time, is that everything we say here today is being recorded. But what if all of our statements today and these important testimonies were never recorded? What if there was just one witness in the room, in this hearing room, not a stenographer, but just an observer who recorded a personal analysis of your testimony? Would you take this personal analysis as an accurate record of your testimony? Do you want the most important statements of your life to be at the mercy of one person with their pen? The lack of transparency and accountability within child welfare systems all across the country is appalling. Police are required to wear body cameras in most states. And the Department of Justice Office on Juvenile Delinquency Prevention has stated that recording child interviews is best practice since 2015, over 10 years ago. And since then, more than 900 federally funded child advocacy centers record child interviews, almost all of them, throughout the U.S. in all 50 states. Anyway, and so former CPS caseworker, the bill, even our doctor now records. Thank you.
Yes, we appreciate it, and I think that some of the the statistics you shared, you are welcome to submit your full testimony online. I think we might be in a good position for this bill. I'm back to the committee. There was nobody who signed up online to speak in opposition to the bill. This bill, just for the committee to know, does not need to be referred to appropriations.
Second.
There's been a motion that's properly seconded to report House Bill 1222. Madam Clerk, if you can please open the roll. All those, and please cast your vote. Please close the roll. And this bill, we recommend to report by vote of 8-0. Thank you very much. And Ms. Ann, thank you for staying with us through the evening to provide your testimony.
Thank you, Madam Chair, and thank you, committee.
All right. Next, I'm going to ask Delegate Kent to come up. Delegate Kent has House Bill 651, and I just want to let our committee members and the public know that this, the contents of this bill is very similar to a bill that we will hear later on this afternoon.
Tonight.
Sorry. Later on tonight. So what I'm going to do is hold witness testimony until we hear that bill later on. But I want to give Delegate Kent a chance to make her statement about the bill.
Thank you so much, committee chairs and committee chair and committee. My bill directs the Virginia Department of Social Services to amend the current regulation that requires face-to-face interviews with victim children, raising that from 2 years of age to 3 years of age. There is a plethora of data that supports the need for this under the current situation, and really came from the Children's Ombudsman that noticed that the children under 3 cannot self-report. They're at the highest risk for death and injury. And so we support it and appreciate that the committee will support it. And so just wanted to say that we're on board with that, and thank you for letting me present this, and look forward to voting on the legislation. So at the will of the committee.
Thank you so much, Delegate Kent. As I said, because this bill is very similar to a bill we'll hear later on this evening, we are going to do all of the kind of that bill hearing and witness testimony later so we don't duplicate. Delegate Shin.
Thank you, Madam Chair. I think to that point, because this element, Madam Chair, could I speak to the bill really quickly, and then I've got a motion for you.
Go ahead.
I serve on the Commission on Youth, and we heard directly from Director Reynolds, the Ombudsman of Children in the Children's Office of Ombudsman. And this is clearly a really big concern, and so it's nice to see so many of my colleagues willing to jump in to tackle this problem and understanding how important it is. The death rate of kids happening in the Commonwealth is something that should be deeply troubling for all of us, and I really appreciate your efforts to bring this forward as one measure in figuring out how we can sort of end that, because again, it is something that we should be all working towards. And so with that, and with thanks to the delegate for carrying this bill, I'm going to make a motion to lay this on the table, because that particular segment of raising it from 2 to 3 is included in House Bill 1490.
Second.
There's been a motion to gently lay this bill on the table. It's properly seconded. Madam Clerk, if you can open the roll, and if everybody can cast their vote. All right, and that motion passes by a vote of 8-0. Thank you very much,
For letting me
Delegate
speak
Kent.
to it. Thank you so much.
Appreciate you. All right, Delegate Carlson. Delegate Carlson, I think you have 3 bills and a lot of paper. Which bill would you like to go through first?
Madam Chair, I would leave it up to you.
Well, the first one would be House Bill 632.
Okay.
Okay. It's just a numerical order.
Okay. This is actually quite an interesting
All right,
one.
members of the committee, we will have House Bill 632 in front of us.
Thank you, Madam Chair, members of the committee. House Bill 632 addresses a barrier in our foster care system that too often prevents children from being placed safely with relatives or victim kin who know and love them. As it was just said, so I'm not going to rehash it, Virginia does lag behind other states in several metrics, actually. One of them is how often we place children with family members or non-strangers, people that are known to them. And we know that that's tied to better long-term outcomes for those children. And so we have barrier crimes. I worked on bills in the past. I know many of you have. They are meant to provide safety, but there is no exception that is ever possible. And having worked in DSS for many years, the goal of placing children is always the best interest of the child. And there are absolutely times where one size fits all does not work. There are times when the only option that is available to a child is to go live in a group home in another state away from everyone they know. Or there's someone right here who is willing, able, and has been assessed as safely able to take care of them, but they have a barrier crime from 20 years ago. And so what this process is, it's not to get rid of barrier crimes. They all still will exist as normal. It is creating a process with several safeguards for how the DSS, which we already trust to make all those assessments and safety assessments, to apply for a waiver. And I would like to just note that any child that's placed in foster care has numerous safeguards beyond just the assessment of DSS. There are family partnership meetings every month. There are ongoing hearings. There are judges looking over the plans. There are several lawyers, a guardian ad litem, and often a CASA advocates. So this is the goal of the bill, to create that waiver process.
Thank you very much, Delegate Carlson. Are there questions from the committee? I see Delegate Henson has his hand up.
Thank you, Madam Chair. Question for the patron.
Yep.
I got the context clues and I understand, but I just wanted you to clarify what is a barrier crime.
Yeah, so
non-legalese people.
Yeah, so barrier crime is a list of identified crimes that typically prevent DSS from placing a child with a family member. If I can give some opinion on it, there's certainly a need for a lot of them, and there's a reason they're there. But the way that Virginia lists them is we have a giant barrier crime section that then basically every other code section refers to, which means that sometimes crimes that wouldn't necessarily impact your ability to care for your relative, because these are not people seeking out to be foster parents. These are people who are called to be foster parents because a family member needs them, that they wouldn't necessarily be applicable. Like one of them, I think, is hunting without a license. So those are the kind of things that can prevent placement.
Madam Chair.
Delegate Henson.
Thank you. I just want to thank the patron for clarifying, because I think that is important. Understanding something as hunting without a license will bar you from taking care of a loved one. Thank you.
Are there any other questions from our committee? I don't see any hands up. Are there folks in the room who wish to speak in support of this bill? If you can please line up, and if you can please keep your comments to new insights that have not been shared by other witnesses, that would be great. Good evening.
Good evening, Madam Chair and committee members. My name is Nina Marino, and I'm with Shineforth Child and Family Services. We're here to support House Bill 632. Virginia's extensive barrier crime list includes many nonviolent and misdemeanor offenses. A decades-old charge unrelated to child safety should not automatically disqualify a grandparent, an aunt, or an uncle from caring for a child they know. Recently, a social worker in Southwest Virginia shared a case involving 3 siblings who cannot live with their paternal grandmother, someone they've known their entire lives, due to a barrier crime. Instead, they remain placed with strangers while other options are explored. Over the past 2 years, at least 118 families were deemed ineligible to care for their relatives due to past barrier crimes. But the true count is much higher because many families don't go through the process once they learn about the barrier crime list. House Bill 632 would prevent situations like this, and we respectfully ask for your support in passing this legislation to prioritize safe, stable, and meaningful family connections for kids in foster care. Thank you.
Great. Thank you so much. Good evening. If you can please share new insights that have not been lifted up yet.
Madam Chair, Nicole Brenner with Seven Hill Strategy Group on behalf of the Virginia Coalition of Private Provider Associations would ask you to support.
Thank you. Good evening.
Good evening. Jordan Roberts with Voices for Virginia's Children, and for the reasons previously stated, we ask that you support the bill and thank the patron for bringing it forward.
Thank you. Good evening.
Good evening, Madam Chair. Valerie LaRue, Center for Family Advocacy at Virginia Poverty Law Center, and for reasons already stated, we also support this bill. Thank you.
Thank you. Are there any folks in the room who wish to speak in opposition to the bill? I don't see anybody lining up, and there is nobody online that signed up. This bill is now back with our committee.
Move to report.
Second. There's been a motion. There's been a motion that's properly seconded to report House Bill 632. Madam Clerk, if you can open the roll. Madam Clerk, if you can close the roll, and this bill is recommended to report by a vote of 7-0. And I just want to take a chair's prerogative to say, addressing this issue of barrier crimes to ensure that folks who are most close to our vulnerable kids are able to care for them has been going on before I came on and throughout my time here, so I appreciate your work, Delegate Coulson. All right, your next bill, can we do House Bill 1060?
Thank you, Chair Tran. So this one is more of a technical fix, and I'm happy to answer questions. I'm going to try to move through it fairly quickly. But with stressing a few points, this is cleanup legislation related to barrier crimes. It does not expand. The descriptions might make it seem it does not expand reduce barrier crimes in any way. It's a cleanup bill. It takes out a duplicative reference to the existing barrier crimes and just refers to one statute so that workers aren't having to look at multiple areas where they need to examine barrier crimes. It also strikes a code section in 63.2/1721 to comply with federal law. And it clarifies, so this would be the one change, but it's really a clarification, that all of this workaround background barrier crimes applies to all members of the household, not just the primary adult. And that's the bill.
Great. Thank you very much, Delegate Coulson. Are there any questions from our committee members? And I just want to say, I think we have the Children's Ombudsman. We have our Deputy Commissioner, Carl Ayers, here with us. So if you have technical questions, we also have some folks in the room who can provide assistance. Delegate Cohen.
Thank you, Madam Chair. A question for the patron?
Go ahead, Delegate.
Thank you. Is there a way in what you're doing to sort of make some of the statutes evergreen as laws change over time? I can think of our marijuana laws and how they changed a few years ago, whereas previously, having a possession charge or any of that would have been a barrier to being able to have a kinship placement. So is that just something we have to come in and fix anytime that it changes, or is there some way to make it evergreen?
Chair Tran, my response to the patron would be that upon information and belief, I think it's something we would just have to come and fix, because I'm drawing on my experience from when I was dealing with this code section 2 years ago, and I remember I was just having to kind of carve out some specific changes.
Okay, I'm looking at the commissioner. He's nodding. Thumbs up. Thumbs up. Okay, that was exactly right. All right, your memory is correct. Are there any other questions from our committee members? I don't see any hands up. Are there folks in the room who wish to speak in support of this bill? Or is there anybody here who wishes to speak in opposition? And we don't have anybody signed up online. The bill is back with our committee.
Move to report.
Second.
There's been a motion to report that's properly seconded for House Bill 1060. Madam Clerk has opened the roll. Please cast your vote. And this bill is recommended to report by a vote of 7-0. Delegate Carlson, your third bill.
Thank you, Chair Tran. I was doing so well today, but I've had so much paper that I lost my overall talking points, but that's fine. I'm happy to share what I know. So this bill, or share my bill.
So we have House Bill 1366 in front of us, committee members.
So House Bill 1366 is the result and the culmination of a lot of work and study that was done in our current DSS. We have these localities that are independently basically doing their DSS stuff, and what we've realized is that we are lacking the oversight. We are lacking the ability to hold Department of Social Services accountable when things are not going according to plan. So we have rules and regulations, and we have the ombudsmen, and we certainly have, they know what they should be doing, but if that's not happening, we don't really have the ability for the State Department to step in and do anything. And so the goal of this bill, without getting too into the weeds, because y'all have it in front of you, is to provide that accountability, provide that ability for the state to step in. We did hear from local departments of social services, and we also added in the ability, which I should say is in a substitute, if I can move the substitute.
All those in favor of moving the substitute? Aye. Any opposed? All right, so the substituted bill is before us, and I'm sure this is what you're speaking to.
Yes, so we added the ability for local DSSs to actually proactively request support when they need it, because sometimes they know they are not hitting their benchmarks and they would like the assistance. I understand that sometimes this is highly technical work when you're doing benefits administration, and if you have a smaller department, sometimes you need additional help, resources, or training to make sure that you're accomplishing what you want. I will note it applies to all Department of Social Services, and there is a good need for it because it does affect funding. So Virginia has an error rate that is, it's not higher than the national average. It is fine, but it is higher than what it is supposed to be, which is 6%. And if we do not bring our error rate down, we will lose federal funding. In addition, which some of the people who speak might be able to talk more about, since I don't have my notes in front of me, there's been some other studies where we are lagging behind that might result in financial penalties if we do not fix them. And so this is providing that ability for us to step in, for us to make sure that children are getting safe, secure outcomes at the rate that they should be getting them, and to help bring these departments along and provide those services to them. So with that, I'll leave it.
Thank you so much, Delegate Carlson. Delegate Cohen has her hand up.
Thank you so much. Speaking to the bill.
Let's see first if we have any questions from this committee. I don't see any hands up. Go ahead, Delegate Cohen.
Thank you. I really want to thank the patrons so much and thank Mr. Ayers back there. I think, when we have looked at the child welfare system generally, it is a big elephant that you are definitely going to have to fix kind of one bite at a time. And I appreciate tonight is a great example, if folks are still with us and following along, of doing exactly that, of really trying to get at what are the most important pieces and then sort of how do they all play together. And I know we still have a couple more bills to speak to that too. But I will say to you that I think the vast majority of people in Virginia have no idea that while the system is locally administered, that there is no state oversight, that the state is not able to jump in when a local DSS is either struggling, needs some more support, needs to be taken over in some ways, or maybe just more staff. So it was very surprising to me to learn that. Is how I got to know Mr. Ayers from a case of a constituent. And I think that Virginia will really be ripe for this and be much, much better to have that oversight and authority that we really need over the local DSSs. And again, not to say that they're necessarily even doing anything wrong, but this is support that I think that they all need. So could not be a bigger fan of this bill, and thank you for bringing it.
Thank you, Delegate Cohen. Are there folks in the room who wish to speak in support of this bill? If you could please line up. If you could please share insight that has not already been lifted up, that would be great. Mr. Ayers, Commissioner.
Yes, good evening, Madam Chair, members of the committee. I'm Carl Ayers, Deputy Commissioner of Human Services for the Virginia Department of Social Services. Thank you, Delegate Carlson, for carrying this bill on behalf of our agency and the system that we are trying to improve here. Have a strong position of support from the governor's office, from our agency on behalf of the 280 plus stakeholders that helped us put together the recommendations to bring to you this evening. And Delegate Cohen shared a personal example from something we've worked on over the years that this bill will directly allow us to be able to improve our system in the future. So thank you for your support.
Thank you, sir. Good evening.
Madam Chair, members of the subcommittee, Nicole Brenner speaking on behalf of the Virginia Children's Partnership. Since I'm trying to be only additive, I will point out that the General Assembly made an incremental change in 2018 or 2019 to implement corrective action, but it was limited only to foster care. And so now you are doing it for everything else, public assistance and child welfare. Would ask you to support. Thank you.
Thank you, and good evening.
Good evening again. I'm Jessica Hopp. In order for things to run effectively, there must be accountability and oversight. For too long in Virginia, operating under a state-funded, locally administered model, there's been no way to do this. HB 1366 would allow the state to step in when the local departments are failing in their duties. I urge you to vote yes on this bill so that corruption and poor practices can be addressed when necessary. Thank you.
Thank you so much. Good evening to our ombudsman.
Good evening, Madam Chair and members of the subcommittee. Eric Reynolds, Children's Ombudsman, and I support this bill and ask that you report it as well. Thank you.
Great. Thank you. Are there folks in the room who wish to speak in opposition to this bill? Okay, I don't see anybody lining up. I do not believe we have anybody online. If this bill, wait 1 second, let me check my notes. Yes, if this bill, the appropriate motion for this bill would be to report and refer to appropriations.
As substituted.
As substituted.
So move.
Second.
There's been a motion to report and refer as substituted to appropriations, House Bill 1366. Madam Clerk is on it. Cast your vote. And, okay, we can close the roll, and that motion passes by a vote of 6-1. Thank you very much, Delegate Carlson.
Thank you, members of the committee and Chair.
Yes, Delegate Keys-Gamarra.
Thank you, Madam Chair, members of the committee. I will try to do this as quickly as possible. This is a bill coming back for a second time.
Delegate Keys-Gamarra, yes, we have House Bill 76.
Yes, House Bill, yes, the foster care bill. And I believe there's a substitute.
I think so. There's a substitute for this bill, members?
Second.
All those in favor? Right, the substitute is properly before us. If you can describe the bill as substituted, that would be great.
So this bill is designed to improve the foster care system by making sure that children moving into the foster care system, that their belongings are moved not in a trash bag, but a suitcase. And the substitute is designed to, rather than make it a wholesale addressing of problems across the department, but to create a pilot program that would allow them to, one, assess where they are already. There are some locations that are working toward this goal already. To be able to identify where the more significant needs might be. And I do thank where did he? Yes, I'm sorry, it's very late. The help from the department in figuring this out. And so we wanted to start as a pilot to get an idea how to address this. It's all about dignity. It is about improving the experience of children in foster care. And I hope that it is the will of this body to report this bill.
Thank you so much, Delegate. Are there questions from the committee? Delegate Henson.
Not a question, but speaking to the bill.
I don't see any other hands up. Go ahead, Delegate Henson.
Thank you, Madam Chair. I would like to thank the delegate for bringing this bill back because I know I think it was 2024 you brought this bill, or 2025 you brought this bill, and you got the meat and potatoes, and I was upset that we gently laid it on the table. So the fact that this is back and you've done the work, I really do appreciate it. Thank you, Madam Chair.
Thank you, Delegate. Are there folks in the room who wish to speak in support of this bill? Oh, I see a line coming up. Please come on up. Please keep your comments to new insights that haven't been lifted up before. And I just want to say, just as somebody who's like 5 feet tall, you can adjust the microphone so we can hear you better. Go ahead.
Thank you, Madam Chair, members of the committee. My name is Lawrence Webb from Fairfax County. Again, I am a foster parent and have done this for over 6 or 7 years. And every kid who's come into my home has come in with trash bags. When they leave our home, they actually leave out, again, we're spending the money, but they're leaving with a suitcase or some type of carry bag so that they are leaving with actual luggage and not a trash bag. So I 100% support this bill.
Thank you. Good evening.
Good evening. Jordan Roberts with Voices for Virginia's Children. As mentioned and then added, carrying possessions in trash bags is a dehumanizing practice that signals to children that their lives are disposable and that their placements are not permanent. Every child deserves dignity during what is already a traumatic experience. Providing basic luggage is a small investment that recognizes the humanity of these children and helps them maintain a sense of self-worth during difficult transitions. We urge your support for the pilot program. Thank you.
Thank you. Good evening again.
Good evening, Madam Chair and Committee. Valerie LaRue, Virginia Poverty Law Center, and we also support the bill. Thank you.
Great, thank you. Are there any folks in the room who wish to speak in opposition to this bill? I don't see anybody getting up, and there's nobody signed up online. The appropriate motion for this bill would be to report and refer to appropriations.
Move to report and refer.
As substituted.
To appropriations as substituted.
Second. There's been a motion properly seconded to report and refer as substituted to appropriations. Madam Clerk, please cast your vote. And we can close a roll, and that motion passes by a vote of 7-0. Thank you very much for fighting for the dignity of our kids.
Thank you.
Good night. Delegate Hayes, Chairman Hayes.
Thank you so much, Madam Chair and members of the committee. You have before you House Bill 652, and there is a substitute.
Move the substitute.
There's been a motion to move the substitute. All those in favor say aye.
Aye.
Any opposed? All right, the substitute is properly before us. If you can explain the bill as substituted, sir.
Thank you so much, Madam Chair. House Bill 652 is about advancing evidence-based, not punitive, practices to support the mother and the baby as a unit in a pregnancy with substance exposure. We all share the same goal of safety, of the child's safety, but widespread evidence demonstrates that child protective services first and punitive approaches decrease prenatal care and treatment uptake without improving neonatal outcomes. Fear of the child protective services means that the Virginia moms avoid prenatal care. This isn't safe. Research reports that maternal race and ethnicity, substance type, and socioeconomic status affect whether or not the Child Protective Services report will be made. The intent of the bill was to amend the Virginia Code to remove the implication that substance exposure should result in a Child Protective Services report. Discussions with the state agencies and partners revealed that a complex system that will not be fixed simply amending this section of the code. This substitute will bring state agencies and stakeholders together to review the Commonwealth's response to and services available to address parental, prenatal, and postnatal substance use and the effects of such substance abuse. The bill will move us towards supportive rather than punitive policies. And Madam Chair, members of the committee, I ask that you support this piece of legislation.
Great. Thank you so much, Delegate Hayes. The bill, and like all of our bills, the substitute is available online. Are there any questions from our committee? Okay. I don't see any hands up. Are there folks in the room who wish to speak in support of this bill? Please line up. And as before, please share testimony that are new insights that have not been lifted up yet. Good evening.
Good evening, Catherine Haynes, Virginia Interfaith Center for Public Policy. This bill, like so many of our bills, came from stories in the community. Having practiced as a midwife, I was aware that, as the delegate mentioned, and we thank him for carrying this critical bill, that prenatal care is avoided. I know a midwife that 50% of her clients were CPS referrals. So these stories in the community discourage care. We brought a number of stakeholders together, March of Dimes, Poverty Law Center. MSV is in support, I'm authorized to say, and ACOG, Birth in Color. We worked with JMU, UVA, and VCU professors, and all there are people behind me, so I'll leave it at that. But plans of safe care, which are in the substitute, will change outcomes and keep people safe. Thank you.
Great. Thank you so much. Good evening. If you can share new insight that has not been shared before, that would be great.
Yes, hello, good evening, and thank you, Madam Chair. My name is Adriana Ross. I'm a licensed midwife, and I practice out of the hospital. I have firsthand experience of people with substance use disorders seeking care for out of the hospital simply because they are worried about going to the hospital because of CPS involvement. This does not mean that they're appropriate for out-of-hospital care, but I'm just speaking to what I'm seeing people contact me. Midwives are really good at building trust and connection. Once people are receiving care, they can be connected to other community services. The goal is to support the mother-baby dyad, and I can tell you that fear of CPS absolutely keeps people from receiving prenatal care. If we want to help moms and babies and reduce preterm birth and improve outcomes, then we need to remove the punitive policies for SUD, and this is not just for opioids, but for all substance use disorders, and then move towards safe care plans, which are evidence-based. Thank you.
Thank you so much. Good evening.
Hi, Chloe Edwards, Policy Director at New Virginia Majority. As a foster care alumni myself, I know that the best thing for children is always family preservation if we can do that safely. And this creates a pathway to safety, but also keeping families together, which is best for the child. Thank you.
Great. Thank you so much. Good evening.
Good evening, Madam Chair. Valerie LaRue, Center for Family Advocacy at Virginia Poverty Law Center. And we support this bill, and thank you very much, Delegate Hayes, for bringing it. The code section that this bill would interact with is one that has been around for a long time and has over the years been piecemeal, edited here, edited there, edited here, and it has created some confusion and inconsistent practices across the state in response to this situation. So this bill will bring stakeholders together to do a deep dive into what the statute should look like so that there is no longer confusion and this issue is addressed. Thank you.
Great. Thank you so much. Good evening. Again.
Good evening, Jordan Roberts with Voices for Virginia's Children. For all the reasons previously stated, we urge the committee to support this bill and thank the patron.
Thank you. Our Children's Ombudsman.
Good evening, Madam Chair, members of the subcommittee. This issue is very complex. The statute that this was trying to amend originally as introduced is very complex. And as my colleague from the Virginia Poverty Law Center said, there is a lot of confusion. And that's what I found in my reviews of cases involving substance-exposed infants and the child fatalities of some of those children that are born substance-exposed. There's a lot of confusion. There's a lot of different practices, varied practices that are some not so good and some very good throughout the state. And so I appreciate Delegate Hayes' consideration of the substitute in doing a study, because we need the stakeholders back together. We need to take a look at this very complex issue and make sure that our statute is striking the proper balance between supporting moms who need the help and the treatment that they need, as well as protecting children and making sure our child protection system is not punitive, but is actually protecting children and saving lives. So thank you, and ask that you support the bill. Thank you.
Thank you, sir. Are there any folks in the room who wish to speak in opposition to this bill? I don't see any, but I do see Elizabeth online. If you can please share your comments, and I know you had a chance to hear everyone. If you can share information that would be new for our committee, that would be great.
Absolutely. Thank you so much. Have a good evening, everyone. I'm Dr. Elizabeth Kelb. I'm the Director of Maternal and Infant Health at March of Dimes for the state of Virginia and across the DMV region. I'm an epidemiologist, and I think in public health often the data is vague, but in this situation the data is not, and it is showing in our peer-reviewed evidence that punitive and CPS first approaches are not effective. And I'd like to point out that House Bill 652 is far more comprehensive than policies that narrowly focus on just one thing, like prescription opioid abuse during pregnancy. Rather than carving out one specific substance or one specific clinical scenario, this bill establishes a consistent evidence-based framework for all cases of prenatal substance abuse and exposure, prescribed or not prescribed, and centers on actual health and safety risks rather than suspicion. This is how effective systems actually protect children based on the evidence. It keeps the door open while also maintaining appropriate clinical and safety oversight, and I respectfully urge you to support this bill, and I'm happy to answer any questions.
Thank you so much, Ms. Elizabeth. Are there any, we don't have anybody who signed up to speak in opposition to this bill. It is now before our committee.
Move to report as substituted.
Second. Oh, I do have a hand up. We have a motion that's been seconded, and let us vote on that motion, or do you have a question, Delegate Walker? I want to make sure that you have a chance to ask or speak to the bill.
Since there's a motion on the floor, and I think it's a motion I'm going to like, I was just going to speak to it. The body down the hall from the esteemed House, I noticed has passed this unanimous. I did have a lady this morning in my office who I worked with back in Lynchburg, Desmond Withry, and she strongly supported this. So if we continue with the process and let's get it passed and moved on, that'd be fine. Thank you.
Thank you so much, Delegate Walker. I'm so glad to hear of wide regional support for this bill. It is the motion that's been properly seconded is to report as substituted. Madam Clerk will open the roll. So, all right, we can close the roll, and this motion passes by a vote of 5-1. Thank you so much, Delegate Hayes.
Thank you, Madam Chair, members of the committee.
Thank you. Delegate Glass. Members of the committee, we have House Bill 578 before us.
I hope I'm it for you today.
Two more after you.
Okay, let's get to it then. Thank you, Madam Chair. Before you, you have House Bill 578. Last year, it was brought to my attention, actually from a person that works here in the building, a story about how military benefits of survivor children who were in foster care were being taken and used as sort of a payment for their stay in foster care. We brought a bill last year that fixed that to say that at the very minimum, if a child is in foster care and they are receiving survivor's benefits, specific military survivor benefits, that we have a responsibility not to just take that money on as a state, but ensure that once they exited foster care, they had some level of a trust or able sort of account. That's also happening now with children with SSI benefits. And so this bill poses the question, I think, is if a child has benefits in their names, does that belong to the child or does it belong to the system? This bill does several things. It are 6 things, I think, here. It requires that local social services within 60 days of a child entering the foster care, that requires them to check within 60 days if a child in foster care qualifies for federal benefits and to actually continue checking each year. The second thing it does, it requires them to apply for those benefits on the child's behalf. The third thing, which is the most important thing we found was not happening, is that when these benefits were applied for on behalf of the child, neither the child or the guardian knew that the state was receiving these benefits on their behalf. So it requires them to tell the child and their legal advocates when benefits are applied for and approved. The third thing that it does is make sure that the person that is managing that child's money, or who would be called like the representative payee, that's what it's called in the bill, is truly acting in the best interest of the child. It also only lets that foster care agency manage the money if there's no better option that exists for that child. Two more things, I swear. So, and then it requires them to use that money only for the personal needs, not to cover the state, what the state is already supposed to pay. What I'm saying is it's only children that are receiving benefits are being charged the babysitting charge, if that makes any sense. Other kids are not being charged this. And the last, and I think the most important thing as we consider, Madam Chair, when a child exits foster care, it requires them to save that leftover money in a protected account, like a trust or ABLE account, so that child can use it when they exit the system. I could go into all the reasons as to what the goal is, but I think you understand based off of those things what the goal is. At the core, I fundamentally believe that if a child is receiving a benefit, that it does in some aspect belong to them. I received a FISC yesterday evening, and it was both angering and heartbreaking that we are taking almost $3 million. That is the gap that we would end up having. And what places in my mind more importantly is the children that are walking out of our I'm saying childcare because they're getting charged like they're in childcare, that are walking away from our system in Virginia, unhoused, without the ability to go to school, without family, without direction, without even just a footing. So what I hope this bill at its core does was provide an opportunity for those children that are charged under our care, under our foster care system, the opportunity to leave with some dignity. Gratitude, Madam Chair.
Thank you so much, Delegate Glass. I have a hands up from Delegate Henson.
Thank you, Madam Chair. I'll wait if anybody has a question, because I wanted to speak to the bill.
All right, he'd like to speak to it. Are there any questions? I don't see other hands up. Delegate Henson.
Thank you. I just want to thank the patron for bringing this bill forward, but I also want to thank whoever stopped you in the hallway or in your office to tell you this. A lot of people don't realize having that intimate conversation with delegates and senators here, you can change the lives of many people. So I just want to thank you for that, and whoever came to you.
Thank you, Delegate Henson. Are there any other questions from committee members? Are there folks in the room who wish to speak in support of this bill? All right. Are there any folks who wish to speak in opposition? Okay, so this bill is back with the committee, and I'm just going to take Chair's prerogative and make a comment. Delegate Glass, I am so appreciative that you have brought this issue to light, because the way I look at it, we are stealing $3.1 million from our foster care kids and paying for their care with that money. And I think that's atrocious, and I hope that we as a Commonwealth can and should do better and be able to make headway on this issue so that we as the state own our responsibility in caring for these very vulnerable kids. This bill would need to be reported and referred to appropriation if that is the will of the committee.
Move to report and refer to appropriations.
There's been a motion to report and refer this bill to appropriations. House Bill 578. Madam Clerk, if you can open the roll. All right, if everybody has voted, this bill is recommended to refer and report to appropriations by a vote of 6-0. Thank you, Delegate Glass.
Gratitude, Madam Chair, and the members of the committee.
So, Madam Chair, while we're waiting on Delegate Krizek, we can at least hear your bill.
Yes. Mr. Chair, one moment. Okay. I'd like to hear House Bill 1495 first, please.
All right. Go ahead.
Okay. One moment. Well, there's so many bills today, so I feel a little bit like our earlier patron who's like, where all my notes go. This issue is brought to me by some of my constituents. I see that they're online and they will be able to testify and share with you themselves. But I do want to say that we have a situation where some of our very vulnerable family members who are cared for by home care workers and have a process by which they must get checked in on, every so often, have their eligibility redetermined, and the paperwork must be submitted in time. So therefore, these interviews and home visits must occur in a timely manner. That isn't happening for a lot of our families. And we want to make sure that those service facilitators who are responsible for those activities are doing so in a way that is timely and does not put at risk the Medicaid coverage that our families have as a result if they don't meet the timelines and get their eligibility redetermination paperwork in on time. And so with that, I would welcome questions from our committee, but I do recall that I do have a substitute. Then we got some technical assistance from DMAS, and so if we can move that substitute.
Second.
There's been a motion and a second to move the substitute. All in favor say aye. Aye. All opposed? The bill is now before us as substituted. Delegate Tran.
Thank you, Mr. Chair. And so I just provided kind of the overall crux of the issue. And I wanted to just say that what this bill does is strengthens oversight by DMAS to ensure that our service facilitators come under the statewide fiscal employer agent contract and requires DMAS to develop a formal monitoring and oversight plan. So that would touch upon timely service authorization requests, annual plans of care, individualized service planning, and required reassessment visits. So we want to make sure that all these steps are happening in a timely manner so that coverage is not disrupted. If you need and rely on care, even just like a day or two or a week or more, where you lose that assistance and you lose your Medicaid coverage, is incredibly stressful and detrimental to our families. And we want to avoid that situation if at all possible. Thank you, Mr. Chair.
Thank you, Delegate Tran. Now turning to members of the committee. If the committee has questions, please use your button. Seeing none, we'll now turn on to testimony. So if there's anyone in the audience that wants to speak for the bill, please stand up, line up. Seeing none, anybody in opposition? Seeing none, okay, turning online. First, we have Amanda speaking for the bill.
Thank you, Madam Chair. My name is Amanda Campbell. I'm a constituent of Delegate Trans and a parent and paid caregiver of a child on the CPC Plus waiver. I support this bill because our family has experienced firsthand how breakdowns in service facilitation put critical supports at risk through no fault of the family. Last fall, our Medicaid eligibility lapsed after our facilitator left their agency. Our eligibility status had not changed, but the required paperwork was simply not completed. We eventually regained eligibility once a new facilitator was assigned, but ongoing turnover has meant multiple months of the last year without required check-ins. Our annual review is now overdue. We were just made aware that our facilitator has changed again. We have no contact information for the new person. There was no January check-in, and we've had no communication at all about the annual review. Meanwhile, we're less anxious about whether our attendant hours will continue, an uncertainty many families across the Commonwealth are facing. This bill ensures families aren't penalized when the system fails. That oversight is both reasonable and necessary, and I urge you to support it. Thank you.
Thank you. Moving on to Lindsay.
Thank you, Madam Chair and the members of the committee. My name is Lindsay Latham. I'm a constituent of Delegate Tran and the parent of a child with multiple disabilities who is on the CCC Plus waiver and the DD waitlist. I strongly support this bill because my family experienced this very issue it addresses in October 2025. In June, I promptly completed and submitted my child's Medicaid renewal paperwork. In July, we had our eligibility visit from the state nurse, and our service facilitator completed our monthly check-in the same day. Soon after, she left the organization and we were told someone new would contact us, but no one did. When I called DMAS, they confirmed they hadn't received the service facilitator's report, meaning my son's hours would lapse. Those hours provide essential supports for people with disabilities across the Commonwealth. Families who meet every requirement, submit paperwork on time, and whose loved one's condition hasn't changed should not lose service because of a system failure beyond their control. Thank you very much for your consideration.
Thank you, Lindsay. All right. Delegate Tran, you have the final word.
I hope it's the will of the committee to pass this bill.
All right, turning to the committee for any questions. The committee operates by motion.
Move to report as substituted. Second.
There's been a motion to report as substituted and properly second. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Delegate Tran, your bill reports out 6-0.
Thank you so much, Mr. Chair. I have one more bill for you, House Bill 1490.
All right, go ahead.
Okay, I have a substitute.
So moved.
There's been a motion and a second to move the substitute. All in favor say aye.
Aye.
All opposed? And would you like to speak to the substitute or DLS?
Mr. Chair, I think if I could just explain the bill and what the change is and talk a little bit more about why it's necessary. Thank you. This bill establishes a statewide centralized intake and validity determination process for reports of child abuse and neglect, and requires a 24-hour response to reports of child abuse or neglect for children under age 3. So this was an issue earlier that both Delegate Tata and Delegate Kent had in their various bills. So I really appreciate the bipartisan support to move us in this direction. The substitute includes some technical changes and phases in the implementation of a centralized intake program, and also establishes a work group to help make sure that we are acting on best practices and good data. Alongside Delegate Carlson's legislation earlier, which touched on accountability and oversight, these two bills are a companion modernization of our system. And it's really helps to advance long-studied reforms to Virginia's child welfare system, both aimed at protecting our most vulnerable children and improving consistency of service and care across the Commonwealth. I really want to acknowledge the work of staff of local DSS offices. They're often understaffed, underpaid, and working with a lot of heart and grit to protect our most vulnerable kids. However, our current structure just doesn't work, and I actually think Delegate Cohen in her discussion around the accountability bill really hit it on, right? We have a locally administered but state supervised system, and sometimes there are just gaps in care for our kids. So we want to make sure that children all across Virginia, regardless of the zip code that they live in, have consistent care, and that their needs are prioritized, and that we are all understanding what that care looks like. So the bill strengthens response requirements for our youngest and most vulnerable children with a 24-hour response required for valid reports of abuse or neglect involving kids under 3, and also children with disabilities who may not always be able to advocate for themselves. Delegate Shin alluded to this a little earlier, but in fiscal year 24, 81%, let's just say that, 81% of child maltreatment deaths were investigated by local departments involved kids under the age of 3. And that's just incredibly heartbreaking, and we have an opportunity to try to address that now. Second, the bill establishes a statewide centralized intake and validity determination process for reports of child abuse and neglect. The Department of Social Services would operate a 24/7 centralized intake system to receive all the reports, determine validity, and then assign the cases to appropriate local department for investigation. This helps to address that inconsistency that might happen or that is happening across our localities. Right now, intake and screening decisions vary widely across the Commonwealth. And in fact, last year, the 16 largest localities in Virginia, they screened out 75%. That's 3/4 of the calls that came in, while the national average is closer to 43%. So this wide variation really puts kids at risk. We would not be alone in centralizing intake and validity determination process for our state. 43 other states have this approach, including other states with locally administered and state supervised systems. Notably, 40% of calls already come through the state and are then referred to localities. The key improvement here is around ensuring consistent statewide validity determinations, consistent training, and allowing our local departments to do what they do best, which is hands-on communication, investigation, and services to family. This bill helps to strengthen child safety, improves consistency, and makes our child welfare system more effective. I look forward to any questions you may have tonight.
Thank you, Delegate Tran. Now turning to members of the committee, seeing Delegate Cohen.
Speaking to the bill.
Go ahead.
I just want to thank the patron beyond measure for this and thank Mr. Ayers and his staff, the folks we had an opportunity to meet with Mr. Bennett in Fairfax County to have this conversation of really trying to dive deep into what's working and what isn't. And I think I'm allowed to tell you that Fairfax is excited about 1490. I asked if I could say if you support it, but I didn't hear back. So just pretend I didn't say it if it turns out I'm not allowed to say it. But thank you so much. And I as I said earlier, I just think the number of kids who are going to feel safe and seen and protected, this is one of those where you're glad to have gotten to witness a part of it. So thanks for that.
Thank you. Any other questions before the committee? And just a comment as a temporary chair prerogative, Fairfax does support the bill. They just text me. All right, turning to the audience, does anyone support the bill? Please come up and speak. 1, 2, 3, 4. 5 minutes total. And I'm sure y'all know the rules by now. Go ahead.
Yes, sir. Thank you, Mr. Chair, Madam Chair, for carrying the bill. On behalf of the Department of Social Services, Carl Ayers, Deputy Commissioner of Human Services, we appreciate the Chair carrying this legislation. It is part of what you heard from Delegate Carlson earlier as part of our efforts to improve our system and ensure that our children and families in Virginia are taken care of. I won't repeat anything else that the Chair so eloquently said earlier, but appreciate your support in moving this forward.
Thank you.
Good evening. My name is Jessica Hopp, and I appreciate everything that you're doing for children in our Commonwealth. A lot of what you have said goes to what I've been working on for years. As a mom who's experienced the worst failures of the child welfare system, I ask for support on this bill to allow local corruption and bias to be taken out of decisions. The current system has failed my children and put them in harm's way, and my goal is for this to never happen to anyone else and their children. Requiring all reports to be entered in the central intake system would mean locals can't just screen things out, and patterns can be detected. We need a strong system with accountability and oversight every step of the way so that we can do a better job for our children. Currently, mothers who report what's happening to their children with evidence have a 90% chance of losing custody to the abuser, and part of this is lack of accountability and oversight in the child welfare system. This bill would be a step in the right direction. Thank you.
Thank you.
Thank you, Mr. Chair and committee. This is my second time testifying on this bill. I spoke on the Senate side of it. This is a bill that is very important to me to make sure that these kids are taken care of regardless of whether they are from where I live now in Fairfax County or where I grew up at in Lunenburg County. It should not make a difference where they are. All these kids are important and should be taken care of, and this bill does that and makes sure that they are taken care of. Thank you.
Thank you.
Mr. Chair, members of the subcommittee, Nicole Brenner speaking on behalf of the Virginia Children's Partnership. We have gratitude for those who work in the child welfare system, but as you know, many legislative studies have found that social services workers have too many functions and are asked to be doing too much, all while being paid too little. This legislation endeavors to take something off their plate, but more importantly, ensure that we have a consistent and uniform response to reports of child abuse and neglect, and this is not an area where there's room for inconsistency. We would ask you to support.
Thank you.
Good evening, Mr. Chair, members of the subcommittee. Eric Reynolds, Children's Ombudsman, and I support this bill. And the two big pieces of this bill, the changes that this bill makes, were recommendations that I made in my annual report last year, and I appreciate Chair Tran carrying this bill for all the reasons that she stated so excellently. So I ask that you support the bill. Thank you.
Thank you. And if anyone would like to speak in opposition, please come forward. All right, seeing none, is there anyone online? I don't believe so. All right, Delegate Tran, you have the final word. I'm good. All right, she's good. Turning back to the committee for any questions. The committee operates by motion.
Move to report, substitute.
And refer to appropriations.
So there's a motion to report and refer as substituted to appropriations. It has been properly seconded. Madam Clerk, please open the roll. Madam Clerk, please close the roll. Madam Chair, your bill reports out 5-1 to appropriations.
Thank you so much, Delegate Henson, and thank you again. I might owe you a big old chocolate bar for taking on chair duties for so long today, a Capri Sun. Just want to say with the folks who might be still listening and the folks who are in this room at 3 hours and 20 minutes after our committee started today, I feel like this is the last meeting of the Social Services Subcommittee before crossover. So we will still be together the second half. But today, I think, is an example of the work we do. And even though, our rooms aren't full the way some of the other bigger committees get, we are putting kids and vulnerable families and vulnerable people at the heart of what we do. We prioritize them. I'm so proud of all the things that we pass out. And I am sprinkling good hopes on them as they head to appropriations. But I appreciate you for being here for these families and kids who need us to help fight for them. Thank you. We'll see you after crossover. Oh, I'm so sorry. You wish we could end, but we cannot. House Bill 851, we will take by for the day. All those in favor. All those in favor say aye. Aye. Any opposed? All right, let's go. We'll see y'all.